Alright guys, not gonna lie, my face is a bit busted up from yesterday. I can see the eyes a bit swollen, but all good. I'm not going to training today because I actually need to lock in for this exam. So we're gonna do this for like 12 hours-ish. Like, I'm gonna log off at like 4 a.m., go to the gym, and then I'll probably go to bed. But yeah, like my devices are gonna be off for a while now. I'm just waiting on Alessandro and whoever else wants to join to come on. And then we're just gonna rip it. Very easy. Let's lock in. I don't know about Jareer, like my boy. My God. Just lock this in. Yeah, like, I can feel this eye a bit swollen. Dude, I don't like that setup. If that's better, easy to start. You might want to put yourself there, boss.
Sorry, yeah, there's a lot of background noise. Give me a sec.
No worries. I'm just fixing my computer screen displays. Don't want my bro. Please stop connecting my iPad.
Yo,
Yes, sir.
I've been looking through the things that you sent.
How'd you find them?
Uh, underwhelming.
There, don't worry. He sent me Charlie's deck as well.
Okay.
It's on WhatsApp though, and I couldn't send it to you because I turned off my phone today. So like, I'm planning on just like completely like ghosting my phone for as long as I can.
I should assume that this is the exam deck that they sent.
Yeah, like I think it's the finals exam deck.
Because the big deck that they sent only has 1,500 cards in it. That has to be the
Hey
exam
man,
deck.
all I'm saying is I just sent what they sent me, bro. I haven't even looked at it myself.
That's so good. Hey, you want to do these questions with me?
Yeah, easy. Screen share them and we can rip them.
I'm down to go to midnight with you on these.
Easy. Yeah, let's just try to finish all of it.
Yeah, absolutely.
Oh, look who's here! Look who's here! The grappling specialist,
Hello.
big dog himself. We're gonna be ripping through 1,500 questions on stream. Like, this stream is going to like it's going on for a long time, bro. That's all I'm gonna say.
Good, good. I'm focused.
Yeah, I'm happy to join in, Nick. But I just got to get my two things up side by side just because there's so many questions.
Let me fix this as well. Easy. That should be nothing like that either. Like this. This will probably be better. Instead, it's gonna look bad on the phone version. Nick, bro, I don't think I told you, but I got invited to a wedding in New Zealand on
Really?
yeah, it's on the 12th of December. I was gonna ask if you wanted to come, but I'm like, Nick's probably not gonna come. So I don't know.
Wait. Tell me details about this. So December 12th, New Zealand. Who is this?
It's one of my photography clients. Like, I was the photographer for their engagement shoot, and she's like, you should come. And I'm like, yo, you know what? Like, if I'm going to New Zealand, I'm gonna go from the 9th to the 12th, leave on the 12th to go to my friend's birthday party.
How much are the flights? Let's see. I'm gonna check.
Bro, 500 for 500 for both ways. It's cheap. And it's a 2-hour flight.
Okay.
You ready?
December.
Yeah, one sec.
It's the day before the party, Nick, that you're going to.
Day before the party. What do you mean by that?
You know that birthday party I got invited to?
Oh fuck, man. There's so many things. Yo, what is the schedule? That's fucked.
Bro, I don't know. I'm just going along with it as it's coming. Like, I don't know what's going on. I literally got the invite last night.
Bro. God damn.
I mean, you can leave on the 11th because I don't know like, if they'll let you come to the wedding itself. Because my plan is to rent a car in New Zealand and like go around to like, you know, Lord of the Rings, like the Hobbit movie.
Yeah.
It was shot in New Zealand. So like the Hobbit town is there. It's close to Auckland. And I'm like, okay, I'm just gonna go there and get as much content as possible.
That sounds like a fun time. I'm
And
not going. I don't think I'll be invited to the wedding. That's for sure. But just exploring New Zealand sounds fun.
so I'm saying, bro, and we can save money by sleeping in the car like retards.
Bro, it's a good time, man.
Yes, sir.
All right. And then the birthday is. Is Alessandro coming to the birthday?
No, he's not coming. So right now it's just you and Umair,
Okay.
which I think she'll be more comfortable with me just bringing 2 people rather than coming with like 3 or 4.
Okay. All right. I don't know. I'm gonna think deeper about this. I'm gonna fucking make a spreadsheet and just plan this all out, man. It's crazy. Fucking
Yeah.
New Zealand, what is it? Brisbane, Melbourne. It's all too much. I gotta see it visually.
Yeah, because the goal in New Zealand is like I'd ideally just want to sleep in the car and just drive around and try to be as cheap as possible. Because I really just want to go there to like explore.
Yeah.
And if we rent hotel rooms, like that's gonna like we're gonna have to be obligated to, you know,
How many days is this?
it's gonna be like the 9th to the 11th, so about two or 3 days.
December 9 to 11. Okay. Sounds good. I'll think about it. Or I'll plan it out.
Yeah, I'm gonna take the sleeping bag and just say fuck it, and sleep in a car, bro. Like,
Okay.
All right, can we not like talk about our personal plans and maybe let's start studying?
yeah, easy.
Because we still have to get through this exam in order to get there.
True, true.
Okay, so question 1. 22-year-old paramedic students cleaning a blood spill on the resus bay floor. Which measure is part of standard precautions and therefore must be applied to every patient regardless of infection status?
A.
Yep, I'll go with A as well. Nick, you too?
I'll just be listening. You guys do your thing.
Yep. All right, the answer is A.
Bro, let's go through all 50 of them first and then look at the answers.
Oh, okay, then I'll have to make a note of what we answered for every question.
I'm already doing that, no worries.
Oh, easy. Thank you. I appreciate that. All right, question 2.
Nurses can't take this into so it's airborne precautions because it's tuberculosis and so that's
Yep.
B, right?
Great. Thank you.
C.
Yep. Internal spread of infection. D.
Internal spread.
Yeah.
Yeah, that's secondary infection
Hmm.
or secondary viremia. Second viremia, I think. D.
Yeah, secondary
Yeah.
viremia. Yeah.
Yeah, C. I agree with you. Well, this motherfucker needs to relax. I read A. A sounds right.
Yeah. Yeah, that's not fenestrated. It's not dominant in the adventitia. That's more like collagen and connective tissue. That's veins, and that's in no. Yeah.
Yeah, that's in the adventitia or
Yeah.
the tunica adventitia.
Well,
Okay.
a large elastic artery, it would have vasa vasorum to help supply it.
Yeah, I
So
would agree
A.
with that. Yeah, A. I agree with A.
Alright.
Like 7B?
I haven't even read it yet.
Plus-
Sorry. Oh yeah, absolutely B. Yeah. 8. I'm gonna go with B.
Sinusoidal
Oh,
discontinuity. Fenestrated with diaphragms. I know sinusoidal, they're in large organs, right?
yeah.
Because in the kidney, they're fenestrated, no?
Yeah, but the kidney isn't an endocrine organ. So we're
Okay,
looking
endocrine.
at the
Okay,
pancreas.
and intestinal villi.
Yeah.
Rapid. The thing it says rapid exchange, so I don't know. Sinusoidal, continuous. If it has a continuous basement membrane, then wouldn't that decrease the amount of exchange that happens? Oh, it's discontinuous. All right, no, I agree. It's B then.
Yeah. It's just the fact that it's a discontinuous for me. Because like you wanna rapidly give everything across. Yeah, I do
Rapid.
like
If
you go.
rapid exchange. I'm still think I'm gonna put B. I'll put C and maybe C as a question mark because it's a good question.
Hmm. I think it's C actually. I'm gonna go with C just because the discontinuous part annoys me because a capillary can never be discontinuous. Because even if it's a sinusoidal capillary, it's continuous by nature. It just means that it has a somewhat permeable basement membrane. Well, yeah, endothelium rather, not basement membrane.
Okay, 9 is C.
I'm gonna go with C for this. Yep, 9 is C. That's pretty easy. 10 is C.
Yeah, anterior tibial. 10 is C.
But yeah, because the
No.
SARS-P is the anterior tibial.
Yeah, no, I agree.
Early diastolic murmur, we want to listen to where aortic is best heard. That is B. Oh, no, A,
Yeah,
sorry.
left. Yeah, it's
A.
A. It's right second.
Yeah, I get that mixed up myself. Give me a second. I'm going to mute myself for a second.
Early diastolic murmur, dyspnea. Diastolic murmur is usually aortic regurgitation. Wait, regurgitation. So diastolic murmur. Mr. 12. Okay. Okay, if it's not auscultation point, it's left fourth costal cartilage. It's B. Let me know if I'm wrong or right there. Yeah, okay, I agree. It's B. Ventricular systole, contraction.
I'm back. Sorry, my people just walked by me at home. Question:
Easy.
ventricular systole, which is true about their pressures.
See, the thing I'm getting messed up in is it's not aortic pressure that falls, it's ventricular pressure that increases. So that's why I'm thinking it's C.
It's C. I agree. Well, by definition, right? If in ventricular systole, it's the contraction of the ventricles, which means that the pressure of the ventricles is increasing, but the pressure of the atrium, so the atrial pressure, is the exact same as it was originally.
Yeah, easy.
This doesn't make sense, this one.
Yeah, it doesn't, because it's not aortic pressure that falls, it's ventricular pressure that's changing.
Yeah. This one obviously doesn't make sense because that's an atrial systole, not ventricular systole.
Yeah, easy.
Yeah, anyway, we'll keep going. A graph shows left ventricular pressure rising rapidly with no change of volume. Oh, that's isovolumetric contraction. Do you agree with that?
Oh, yeah. I'm trying to do the next. It's I already put D down for 14.
Okay. 15 cardiac output is that, and it's 80 per minute. Co equals HR times volume. So I'm going to go with 60 liters.
Okay, easy. 60,
60
15.
milliliters, pardon me, yeah. Because
Makes
80
sense.
times 60 is 4,800. Mean arterial pressure falls after blood loss. Baroreceptor firing decreases and sympathetic outflow rises. What vascular bed is most likely to undergo arteriolar constriction to defend MAP? What?
Mean arterial pressure falls after blood loss. Baroreceptor firing decreases and sympathetic outflow. Not pulmonary. Shouldn't be cerebral. Splanchnic, maybe?
I don't know. I don't think we ever discussed this.
Because my logic is if we're going based off of hypovolemic shock, it's gonna decrease blood flow to the peripheries first, and then everything else there is central. Like coronary is heart's gonna need circulation. Cerebral is a brain definitely needs circulation. So rapid, you have increase in respiratory rate during
Yeah, no,
hypovolemic
I
shock.
agree with that. Well, I think of it as like in the ischemic, CNS ischemic response, it cuts off essentially everything but the essential organs. So it would
Yeah.
cut off your entire gut.
Easy.
B.
Yeah, easy. B.
A metabolically active skeletal muscle during exercise increases its own blood flow despite sympathetic drive. Which mechanism best describes this local order regulation?
C. I haven't
Yeah.
read the other ones. I think this is active hyperemia.
Yeah. A 20-year-old male loses a liter of blood. Initially, he has tachycardia, cool peripheries, and normal blood pressure.
D?
Uses 1 liter. If it's 1 liter, it's type 2 shock. So
Yeah,
this
that's right.
is D, yeah. Because type 2 is 750 to 1.5, I think. Yeah.
No, it isn't.
Persistent hypervolemic shock is left untreated. Which of the following is a key positive feedback change that makes it irreversible? Okay. Wrong. Wrong.
D.
Yeah, that has to be it. A 32-year-old trauma patient has a BP of 80 over 80 over 50, pardon me, heart rate 132, cold climate skin, and delayed cat refill, which is the most immediate physiological goal of fluid resus.
Restore cerebral perfusion.
Yeah. 22 for intravascular volume.
For rapidly restore intravascular. If it's inside the vasculature, it should be E.
Yeah.
Or
But it says in all cases though.
yeah, no, that's colloid only.
It could be, well, it's not that. It's dextran is the colloid, not that. This is
Yeah.
obviously wrong. This is the same as that. I don't know. The issue is we haven't obviously learned this specific yet.
My thing is colloid when blood is not yet available. Saying colloid only, it's very, what do you call it? Extreme, no?
But so is this in all cases.
Yeah, true.
I think I'm just gonna put E and I'll just take the L.
I agree.
Next one.
It's
Sequence of
not
signs.
A.
Okay.
Yeah, I agree. I think it's D.
Yeah.
Tachycardia, full
Oh
pale
wait, hang
skin,
on.
falling
No,
systolic
tachycardia would
pressures.
be first. No.
Yeah, that's what I'm thinking. That's what I'm
So I'm gonna go
thinking.
with
It should be
C.
tachycardia.
Yeah, I'm gonna go with C.
Yeah. It's found conscious and not breathing normally. What is the first step in basic life checking for danger? Yeah. Give 2 rescue breaths. No. Check for yeah, it's C. 24 C. 25. C. Mandatory blood alcohol limits and
Yeah.
randomized breath test.
There's injury prevention.
Weaken alcohol cells and simple penetrating. Simple prevention step. What? I would think
Yeah.
C. That makes the most sense.
That's a
What
dumb
the
question.
fuck?
Look, I've asked
It's-
GPT to come up with 50 questions for every week, so it's gonna be like this.
Okay.
GPT, like I'm telling you, GPT just saw obviously like these questions regarding like the CDT stuff, and it's just running with it.
Fair enough.
Yeah. All right, 27.
It's C. May treat under emergency duty of care provisions. Bro, that's I think we've gotten about 1, 2, 3, 4, 5 C's in a row.
That's okay. I asked GPT to try to make it. It is what it is.
Duty of care in emergency. I've read B so far. That sounds the most right.
Yeah.
29.
Yeah, I'm with going B.
Easy. Safe handling and transport. C?
Yeah.
I haven't read D or E, so
Well, it's non-leaf proof and no biohazard labeling, so obviously it goes against that.
easy.
C.
Yo, okay, doesn't that remind you of the guy from the Rit Trip?
I don't know what you're talking about.
Diabolical. Diabolical.
Uh,
Okay, pansystolic murmur. Uh,
This is more weak.
VSD. Yeah, this is more weak thing, but overriding of the aorta with the VSD.
I'm gonna go with A.
Proper fusion of endocardial fusions. Proper fusion of endocardial cushions forming the. Wait, proper fusion of endocardial. What's the
Ah,
reason for that?
I misread that. Sorry. I'm gonna go with C. I thought it said improper.
Failure. Okay. Failure of foraminal valley. Overriding of the aorta. Abnormal. Okay, what's the reason for you picking C?
Just process of elimination. A, it says proper, so that doesn't make sense.
Yeah,
B, the foramen ovale doesn't relate to a VSD. That's mainly a ASD.
it's an ASD. Yeah,
C, I don't know what the truncus arteriosus is.
that's the
D,
ductus arteriosus.
is the ductus the truncus?
Yeah, that's what I'm assuming because a truncus, ductus.
I don't know. It's a VSD.
Oh, really? Okay, I thought it was a ductus arteriosus. That's why I'm like, yeah, that doesn't make any sense. Never heard of that.
Well, ductus must be the ASD then. Yeah. Oh, yeah.
Because that's one of the temporary treatment methods for tetralogy.
Yeah. Yeah, so this has to be C. D wouldn't relate to the VSD
Mm,
unless it was tetralogy of Fallot. And then abnormality of the pulmonary veins, that really has nothing to do with the VSD.
fair enough. I didn't know what truncus was. I thought they were referring to the ductus. That's
That's
why I'm
right.
like, okay, the only one that makes sense is C.
Oh, good.
Sternal, chest pain, and
Stenosis of the left anterior descending artery. Left anterior, okay. Ischemia of the
I've read B. B sounds about right.
yeah. Well, it's the anterior 2/3 rather.
Yeah.
Sternal heave. That is right ventricular
C.
pathology. So right ventricular hypertrophy. Yep.
What are we at? 34?
Yeah. A healthy 19-year-old stands up suddenly, venous return falls, and arterial pressure briefly drops. Which mechanism restores pressure within seconds?
I
C.
would say C. Yeah.
Well, C is the quickest out of all
Yeah.
these.
Then I think it's A. That would be
Yeah.
next.
And then technically D occurs a little bit after A. B occurs after that because that's a late thing. And then E, we've
Yeah.
never even discussed E.
Easy. Lactate rising.
I'll go
I've
with A.
read A. A sounds about right.
Yeah, that's the only one that makes sense. I don't know what APB is. ABP.
Arterial blood pressure. Ambulatory blood pressure. Okay, bro. What the fuck?
That's okay. Anyway, obviously it has to be A. It's a shock question. Which is a distributive cause of shock?
A,
Anaphylaxis.
no?
Yeah.
36?
Yeah, 36 is A.
Okay.
Patient in early hemorrhagic shock has cool, pale skin. What is the dominant automatic mediator? B.
Sympathetic. Yeah.
Motorcycle rider sustains long. Sorry, I can't read. You know I'm dyslexic. Multiple long bone fractures with significant bone loss. Which combination of findings best indicates decompensated shock? So if it's decompensated, it's probably.
I've read oliguria on D.
Yeah.
B or D? So it's decompensated.
Because it goes progressive, non-progressive, and then
Yeah,
failure, or
that
irreversible.
sounds,
So this is category 3 shock.
yeah, so that's why I don't know. It might be oliguria is the main reason why I'm thinking D, but it probably is B because
I'm going with B because bradycardia actually is a late stage shock.
yeah, I agree.
If we're in category 3, that means that my heart rate is more than 130. Remember the table?
Yeah, that's what I'm thinking B as well. The only thing that's throwing me off is the oliguria. Because oliguria is usually in type 3 and then type 4 is anuria.
Yeah, but we also don't have hypertension.
Yeah, true. I agree.
Yeah,
So B
that-
makes the most sense. I agree with that.
cool. In assessing venipuncture sites, which is really, what is this? Come on.
Yeah, see.
Yeah. A patient has swelling of the neck with prominent superficial veins. You suspect raised CVP, which
No, I'm not even gonna read it.
internal jugular. Oh wait, which vein lies superficially?
Oh, external jugular.
Internal jugular, yeah. Which of the following best describes standard precautions?
Well, what do you mind going up a bit? What was which number was external jugular? B.
40. 41, I'm going with B.
Yeah, I agree. Repeat question.
42. C.
Oh yeah, C. Agreed. Start HIV PEP without assessment.
Yeah. Go straight to theater. That's even better.
Yeah. Proximal modifiable risk factor. I mean, that sounds about right.
Well, yeah, by definition, proximal means it's related to. Modifiable means you can definitely
You
modify
can
it.
change it. Yeah.
44.
I could
CT
see
is
what
limited.
crash victims.
This
CT
is
scans is limited.
This is secondary
Applying the injury control model. What's coming? Okay, secondary.
because you can't scan, and scanning is technically a screen
Yeah, easy.
because they're screening patients for injuries. The doctor is uncertain whether to disclose a small but serious risk. This is a material risk. Disclosure is required when.
See,
Yeah.
a lot of C's here, bro.
That's okay. The GPT tried.
True.
A 19-year-old is treated in ED for a laceration after a crash. He's alert, understands the information, agrees to suturing. Which element
A.
of valid consent? Yes, very easy. The paramedic asks whether law and ethics always gives the same answer, which is the best response. B.
Yeah, B.
25-year-old has lacerations contaminated with soil, which is the most appropriate immediate wound care principle from the infection control.
I read B. B sounds about right. Suture immediately.
Yeah. B. Yeah, don't clean it, just dress it. That makes things better.
100%. Or get right to getting anti. In fact, just leave it in there.
All right, systolic 90, diastolic 70, heart rate 128, cool extremities. Which interpretation is the most consistent? No.
Heart rate is increased. 90 to 70, typical pulse pressure. Cardiogenic shock.
I would
High pulse.
C.
I'm thinking C as well, because 90 to 70 is a small range. No indications. It's not a high pulse pressure with
That's just
warm
wrong.
peripheries. Yeah, that's just straight up wrong.
Yeah.
C, right?
Yeah.
Okay,
A crash
so
victim is hypotensive with suspected intra-abdominal bleeding. Which statement about early management is the most appropriate?
patient's
Uh,
epidemic, suspect early diagnosis, yeah, isotonic. It should go. First thing was that C.
yep.
Okay, so one was A,
Yep.
B,
Yep.
3C,
Yep.
4D,
Yep. Just say the letter.
C,
Yep.
A,
Yep.
B,
Yep.
C,
Yep.
C,
Yep.
C,
Yep.
A,
Yep.
B,
Yep.
C,
Yep.
D,
Yep.
D.
E for question 15.
Oh, okay. What's
Just make a note of it. We'll go back to it, but let's keep going through it.
answer is E.
E. Yep.
16A,
Yep.
B,
Yep.
C,
Yep.
D,
Yep.
D,
Yep.
D,
Yep.
E.
22 was B.
23C.
Yep.
Okay, 23 to 27 is all C.
Great. Yep.
28 is B.
Yep.
29 is C.
Yep.
30 and 31 are C.
31 is A.
Oh, damn.
It's okay. We're learning. But there could be one question.
Yeah, easy. B,
Yep.
C,
Yep.
C. We put A, B,
34 is D.
Yeah, I marked that.
Okay. A, B.
39, C.
Yep.
B for 41.
Yep.
42, 43 is C.
Yep.
44 is B.
Yep.
Well, we put C, but the answer is B. 45 C.
Yep.
A.
Yeah.
B, C. Okay, it's D. C. Right, so we got
Then you
8.
got 44.
Yeah, okay, so we got 15. 15 was D. We put
15 was B.
the 15. The answer is E.
That's wrong. That's wrong. 80 times 75 is not 4,800.
80 times 75. Okay, let's check GPT right here.
Oh, come
80
on.
times
80 times 60 is?
80 times 60. Yeah, that's the answer.
Good. Okay, what's the next one?
All right, so 15, the answer is D.
Mhm.
22.
Ah, they said D.
No, they put B. Oh, initial. Okay. Oh, fuck. Okay, appropriate initial.
Okay, fair enough. We just misread that.
Fuck. 31. We put C. The answer is A.
No, we literally looked this up.
Wait, but I don't get it. Like, if it's a proper fusion, right? That doesn't make any sense.
It's saying A.
But what's a proper fusion of endocardial
okay.
cushions?
We haven't looked at it. It's all right.
It's such bullshit, bro. Okay.
Just remove that. Make it out of 49 because we haven't looked at this. We don't know what a pansystolic murmur is.
All right, easy. 34. The answer is D. We put C.
The answer is D.
Yeah, no, yeah, check that. No, that doesn't make any sense. There's no way you do A and P first.
Yep.
Yeah, okay, so we were right.
Okay. What's the next one?
44. The answer is B. We put C.
No, we said B. Secondary prevention. You noted that wrong.
Okay, easy. My bad.
That's right. Because remember, we spoke about this. Secondary is screening, and technically you're screening for injury.
No, I agree with that. I don't know why I put.
And
I
for
think it's
those
just so many C's.
for those watching at home, you can go back and you can, clearly watch it. We said secondary.
Agreed.
What's the next one?
Oh, OM Sonic says, in my opinion, line is just A. 44, right? 40. Next one is 49. We put C. The answer is D. No, okay, check that one too. That doesn't make any sense to me. High pulse pressure?
How is it diastolic hypertension? This is below regular diastolic.
Yeah, that's what I'm saying.
It's saying D actually, but that doesn't make sense.
Yeah,
High
yeah.
pulse pressure.
With high pulse pressure.
It's a
But how
low.
can it be high pulse pressure? The pulse pressure is low. Look at the explanation. Try putting it. Can you
Gemini.
copy it and send it to me, and I'll put it in my Gemini?
Easy. Give me a sec.
That makes no sense to me, man. Gemini. All right, Gemini.
It could be cardiogenic shock, but the high pulse pressure just eliminates it.
It's saying the answer is C.
That's what we put.
Yeah, and why option C is correct. The pulse pressure is the difference between systolic blood pressure and diastolic blood pressure. Yeah, we know that.
Mm-hmm.
And it's narrow. So why D is incorrect. Cardiogenic shock usually presents with a narrow pulse pressure, but high pulse pressure is incorrect. That's what I'm thinking. Like, if you have cardiogenic shock, you'd have a narrow pulse pressure. So that doesn't make no sense to me, bro.
That's okay. It did a good job with these questions. It actually cooked for week 1.
No, I agree. Maybe didn't cook on the answers, but it definitely cooked on the thing.
So what
So,
did we
well,
get? Did we end up getting 48 out of 49? I think it was.
Yeah,
What was the one that we got wrong? The initial, right?
yeah. That's just we know the answer. Just we read it wrong.
Yeah. So just for me to say it, you always give a crystalloid first, then you give a colloid.
Yes, sir.
All right. Do the exact same for week 2. Okay, let's do this. A registrar is teaching students about hand hygiene. In which of the following situations is alcohol-based rub not appropriate and soap and water washing required? A.
Oh, give me 1 sec. I'm just setting up the thing.
Easy. I'm going with A for question 1.
I haven't even looked at it yet, so just quickly, let me just. 1. I'm gonna try to set it up so we can see the comments on the stage, so I don't need to keep on like closing it. Registrar, after examination of the profuse diarrhea. Yeah, no, I fully agree with you. The answer is A.
Okay. 2. Suspected pertussis. Droplet easy because whooping cough.
Yeah, easy. Bordetella pertussis.
Yeah.
B? Is it B?
Yeah. Oh, wait, hang on. Is it B or A?
I would say
A.
B
I'd say A.
because it's coughing, no?
Yeah. I'm gonna
Isn't it?
stick with B. Sorry, I psyched myself out. Yeah.
Because it's not aerosol, it's droplet because of
Yeah.
the barking cough that happens during Bordetella.
But just the 1 meter part, is that enough?
With surgical masks on within 1 meter,
Yeah.
I think like maybe I know COVID was 2 meters because it depends on the range of spread, but I don't know. I think maybe I'll put A and question marks beside it.
Mm.
But I think it's droplet. It makes more sense for whooping cough to be droplet spread.
Yeah. I just want to think about this.
Yeah, easy.
Yeah, I'm probably gonna stick with droplet. That's all right. During a minor procedure, a student contaminates the sterile fill with their sleeve. Lovely. According to aseptic technique principles, which is the next best step?
I put A.
Yeah, that's fine. Basically, start again.
Yeah.
A nurse is about to perform wound packing on a patient colonized with MRSA. Damn, that patient is like Double.
Yeah, method is
The guy's going, the patient's going through it.
Yeah.
MRSA is Wait,
N95? Is it droplet spread or is it contact?
I don't know. I think I'm gonna go with D.
I was thinking D as well, but now we should probably think about it a bit because N95 respirator, that does make sense to me. To reduce spread to staff uniforms. Okay, no, if it's staff uniforms and the environment, then
The D, yeah.
yeah.
After cleaning up a large blood spill, a health worker places the used sharps container, blood, soiled gauze, and gloves in a clear plastic bag and leaves it in the corridor. Which principles of waste has been breached?
Which hasn't been breached.
Everything. D. Yeah.
The requirement for correct segregation and secure storage of clinical waste. Yeah, okay, agreed.
A 70-kilogram trauma patient has lost about a liter of blood. You use 0.9% saline for initial replacement. Which statement best explains why this fluid is suitable in the first stance?
Distributing
It's
intracellular.
D.
What?
D.
Yeah. Okay. Easy.
Weird question.
Yeah.
A registrar is comparing crystalloids and colloids for volume resus. Which of the following is a recognized feature of common colloids compared to crystalloids?
I read B. B sounds right.
Yeah, that's literally how they work. Yeah. And
7B.
crystalloids are cheaper, so that doesn't make sense. And they're actually not recommended as universal first line because they remain in the intravascular space. They can actually potentially increase bleeding. That's from what I've read. A 25-year-old patient presents with hemorrhagic shock after 2 liters of isotonic crystalloid. His BP is still low, and there are signs of poor perfusion, which is the main physiological objective of continuing replacement.
C. I read. That seems about right.
That's like the same question we had earlier.
Yeah.
Unconscious patient is brought in with penetrating trauma and obvious external bleed. There's no family, which best reflects usual emergency practice.
C.
Yep. A junior doctor is preparing to insert a central venous catheter. Which sequence of actions best reflects the principles of barrier precautions?
I read C. C seems about right.
Yeah. Basically, just do everything you can.
Yeah.
Better safe than sorry. A policy officer wants to reduce health inequalities by intervening very early in life. Which rationale best matches what you've studied about early life and later health?
I read A. A sounds about right.
Yeah. In explaining health of populations to a classmate, which example best distinguishes it from individual clinical care?
B.
Yeah. That's like a bit like technically illegal, no? How would like a government do that?
Hey man. We live in a socialist democracy. They can do whatever they want.
A community has high rates of smoking, unemployment, and overcrowded housing. Which statement best reflects the role of these factors in population health? C. Very easy.
Yeah, easy.
Remember, we're gonna have a lot of repeats for questions because it's like 50 for every week.
No worries, boss. Let's just keep going through it.
Yeah, a GP is asked to join a working group that wants to reduce road traffic injuries in a regional town. Which step is most appropriate after describing the local burden? B.
B. Yeah, agreed.
Public health student compares 2 programs. One provides school breakfast clubs. The other promotes individual counseling for obesity. Which is the best description for the breakfast program club from a population health perspective? C.
Yeah, C.
Nurse removes gloves after touching a wound, touches computer keyboard, then performs hand hygiene. What is the main problem with this sequence? Hand
Removes
hygiene.
gloves. Immediately touches.
A.
Okay, yeah, easy A.
Oh wait, hang on.
No, A makes sense to me.
Yeah, but E doesn't make sense to me. Gloves must always be sterile for wound dressing.
I mean,
But
that's
like,
true.
yeah,
But
that's
in the
true. But
context of the question,
that doesn't make sense. Yeah.
uh,
Patient with known COVID is coughing and requires close contact care on the ward. Standard precautions are in place. What optional things? B.
yeah, agreed. B.
Yep.
E sounds. Oh, no word equipment that for every contract. Nah, maybe
Yeah, but it's
not.
like
That's too much
additional
work.
measures should staff
True,
take.
true. Yeah, easy.
A student is asked why 5% dextrose is not used for initial resus of hypovolemic trauma.
C.
I don't know.
No hypertonic. Contains no. It causes immediate
These are all
coagulopathy. No.
isotonic. These
Yeah,
are
but there's that thing about dextrose where it spreads it to all the compartments equally.
okay. I'm happy with C, but I don't recall anything about dextrose. I don't think we need to know.
Easy.
Cool.
For me, it's between C. I've never heard D before. Immediate coagulopathy, like that. That
No.
makes no sense to me.
Yeah, I'm stuck between A and C. But for
Hypertonic.
me, I don't remember them being hypertonic. I remember
No,
them
they're
all
ISO.
isotonic, so therefore it has to be C.
Wait.
A 60-year-old on the ward has gradually rising pulse. Cool proof is now systolic of 85 after GI bleeding. Damn, systolic of 85. Earlier compensation is failing. Which description best fits his current state?
D.
Yeah.
Was it 19 is D?
Actually,
D. Oh, maybe E.
could be E. Yeah, but it says
Early compensation is failing
yeah,
and
but
gradually rising.
if it's early compensated, it could be progressive. They would give us more information in the exam.
Yeah, that's weird.
But like a systolic of 85.
It makes sense because it should still be decreasing, right? And we're most likely looking at pulse pressure, which should be narrowing with the thing. And also, like the thing that's putting me off towards D is its early compensation is failing. And the next step should be decompensated progressive shock before it goes to irreversible.
No, I agree. I agree. All right, physiological endpoint for adequate fluid resource. B,
Well, we
D.
had this, yeah, D.
That's the only one that makes sense.
Yeah.
In this situation, we can treat first and justify later because the patient will otherwise die, which is
I read A.
yeah, it's fine. Medical student wants to understand how law and ethics relate to medical practice. Again, we had this one earlier. See. Our local council proposes to improve walkability, install shade in parks, and restrict sugary drinks. This is C.
Upstream population interventions on environmental determinants. And restrict sugar drink advertising nation. Yeah, okay, I agree with that.
In a low-income urban area, childhood injury rates remain high despite good ED. What's the next logical focus? This is like the exact same question.
Yeah.
A doctor wants to know whether to use ringers or 0.9 for ongoing treatment replacement. Which statement is most accurate about balanced crystalloids? Yeah. Oh yes, obviously A.
100%.
C.
C. Yeah.
A nurse is about to perform an aseptic. A.
Bro, this is all like primary standard precautions and transmission, bro.
What
I don't
happened?
remember. Yeah, I don't remember this week being so heavy on PPD, PPH, and standard precautions.
I actually do though. We'll skip these questions.
No, let's still go through them because
Alright.
they'll still ask these questions on the exam. 27.
27. Bacterial meningitis.
Protective isolation.
I don't know about meningitis. How does meningitis spread?
It's entry into the meninges through the brain, or like
Yeah, but like how does it get between people?
that's I'm thinking. I'll just go protective isolation, or for me it's between D or A, but A makes no sense, so I'm just going protective isolation.
Hmm.
For the first 24 hours, maybe, yeah.
I agree with that. A student presents a case 2-year-old with severe dehydration secondary to diarrhea. The child is drowsy, heart rate 170, cat refill 4, BP low. C.
Yeah.
Doctor is designing a community program. Again, like what's happening here?
Yeah. I didn't even read that. What you put E?
Oh wait, hang on. Lower income, unstable housing, and little education have worse health than others. I don't know what a social gradient refers to. But let me
Absence of
read.
social determinants. Oh, wait.
Yeah, they don't have like
Yeah.
education. There's an absence of that social determinant. These actions together best illustrate
Which one are we on? 30?
C. Yeah. Oh, I think I know what happened.
What?
Okay, so remember in the syllabus outcomes, week 1 and 2 are combined in Blood on the Road.
Yeah.
So I think this is why it's basically retreading the same questions for week 1 and 2.
Fair.
Because yeah, if like I'm going on it right now, you can see it does both of them. Yeah, it's week 1 and
Fair.
2 combined. Yeah, okay, fair enough.
Let's still go through them. They'll be good practice.
Yeah, I do agree. We were on 31.
Yeah.
A.
Yeah, I agree. 32, I put B. Contact precaution.
Yep. Figure.
Yeah, C. Yeah, no, I agree with B.
Nah, I love C.
Yeah, I fully agree with B.
Trauma patients given large volumes of 0.9 saline. Yeah, this makes sense, but yeah, that's like I understand why the questions are repeating themselves.
Yeah, no, it has to be that because that's the thing that happens when you give too much.
Yeah.
Smoke-free zone, right?
What question are you on?
No, they talked about the smoke-free zone, and I started smoking.
Ah, okay. 36.
Yeah, A.
Yep. 37.
I read B. B sounds about right.
Yep. 38.
Lactate falls and urine output rises. The tissue perfusion has improved.
Yeah, it has to be. 39.
Bro, Nick needs to lock in on these sharp precautions, bro.
40.
Yeah, agreed. You're an output. What number was that? C?
40 was C, yeah.
Letter was that?
40 was C.
Yeah, okay.
41 is A.
Agreed.
42 is
Influenza, airborne.
yeah,
No.
droplets.
Which zip is?
so B.
Yeah, I would agree with B. Airborne isolation only is not good answer.
Yeah, because if they place in a 4-bed bay, it's not going to be airborne. There would be protective isolation otherwise.
Yeah,
C.
yeah, agreed. Anything that has the word cultural in it, I will pick that for that.
Lovely.
Uh,
This is screening, so this is secondary.
Randomized road breath testing coupled with speed cameras. I thought it would be B.
Oh yeah, you're right. My bad. Yeah. That doesn't even make sense. Secondary at hospital level. Yeah. C.
Yeah,
A.
yeah.
B. Damn, it even
Yeah, I
came up
agree.
with the ethical toolbox.
Oh, bro, that's an easy answer right there. I'd read the word ethical toolbox and I wouldn't read anything else.
Yeah. B.
Yeah, agreed. What did you take part of no skin? Though your analysis still like, yeah, agreed. D. Easy.
All right. Read it out.
Okay, so we do A,
Mm-hmm.
B.
Yep.
Okay, 3 is C.
Oh, okay.
4D.
Yep.
E. Oh, 6 is A. Okay. 7B.
Mm-hmm.
C.
Mm-hmm.
9D. Bro. 10C.
Mm-hmm.
11A. B. C. B. 15C. 16A. 17B. 18C. DD. 21A. Oh, then we have 22 to 25C.
Yep.
26A.
Mm-hmm.
Oh, D. Okay, it's B. 28 is C. 29 is. What's the answer for 29?
D.
The fuck? 30 is C.
Yep.
A for B. C. B. C. A. B. B.
Mm-hmm.
39. 40 C.
Mm-hmm.
A. B. 43 C. B. C.
Mm-hmm.
40. A. B. 48 is B.
Mm-hmm.
49 D. 50 C.
All right,
Okay,
great.
let's go 3 C. Wait, what? We
No,
put A.
that's wrong. That's so wrong.
No. Okay, what the fuck? Put that in Gemini, bro.
That's just objectively wrong. Yeah, that's fine. What's the next one?
6. 6 we got wrong. I put send me it.
That's all right.
Oh yeah, easy. Just Gemini it.
Hey,
Yeah, but we put D. Answer was A. Wait, what is that? Expand intravascular communication.
how does it do that though?
Wait, what?
No, saline distributes into the intracellular space. Alright, I gotta see this.
Isn't it the extravascular?
Extracellular space. Oh, I got it mixed up. Yep. It's extracellular and intravascular. Yep. That's a bad mistake. Alright, I'll take the L on that one.
9C. The answer is D.
9 was the answer was D. No, that's not true.
Wait, what?
That's objectively not true. Yeah.
Oh, no. Fuck that, bro. Okay, the
Alright,
next one you got wrong. 27. We put D. The answer is B.
I said them.
B? I'll take the L on that. I'll take the L. I'll take the L
That's
on that.
okay. Remember, we haven't learned how bacterial meningitis is spread. Yeah, it's
Fair
coughing.
enough. I'll take the L on that. I'll take the L
That's
on
all
that.
right. That's all right. I'll take the L on the other one.
29E?
29. Did it
The answer
say-
is D.
Yeah, okay. That's just a weird thing that it says to me.
Yeah, that was easy.
But like I think the wording here is a bit ambiguous, right? Like if they have low income, unstable housing, and little education, you have an absence of those social determinants of health. But here it's saying that obviously you're comparing them, so there's a social gradient in health. But when
My
it's
issue was that like absence of social determinants too extreme of an answer because there still might be social determinants that are present, and it's a bit weird for it to say like complete absence of social determinant.
fair enough. Okay, so it's just a wording thing then.
Yeah.
I'll take the L. What's the next one?
Oh, we got the rest right. I'm just gonna quickly go take a pee, bro. I'll be back. It'll
That's
take me
all-
less than like a minute.
Oh, good. I'm just gonna stretch my legs. But yeah, these next questions should be better. What do you think, Nick?
Yo, I was just wondering, so you guys are just looking at this using your own GPT. Have you looked at the document Whaley wrote?
Sorry?
Or did you look at the document Whaley wrote?
Yes.
Just out of curiosity, why aren't you using that?
Because I already worked through it.
Oh, that's fair.
Yeah.
And yeah, I mean, I'm just listening it through. It's nice to like go through it. So it's good.
Yeah, but we have like infinitely more questions as well.
Yeah. She only does like 20 or something, so it's not that in depth as you guys. So.
Yeah, that's right. I will say
Yeah.
my GPT skipped like the anatomy of the heart, which I'm a little bit annoyed about.
Bro, I mean, but the main problem I feel with this is that you guys are like doing a lot of like written, right? So in the actual exam, you're gonna get graphs and pictures.
Oh, that's
That's
fine. Yeah. I prepared for that. Yeah.
okay. So yeah, I mean, yeah, the image occlusion stuff is I find
Yeah, but like image occlusion again, it's just MCQ, so you can figure it out.
fair enough. You have a histology. Does the MD1 deck have all the histology slides?
Yes. Except like funnily enough, except the ones that were asked in the exam.
Except, yeah, except the ones asked in the exam, right?
I know.
Th-
I
So,
I
so,
genuinely I looked through it and I couldn't find any of like I didn't even know if it was hyaline or elastic cartilage, but apparently it was cartilage. And then
oh,
the
fuck.
bone. And there's literally no bone. Like it's I get what the university did, right? I think it was the week before the exam. They said, "Oh, by the way, all lab content can be assessed as well."
Hmm.
So technically, that is what it is.
How are you just gonna take an L if it comes, or how are you planning to cover for that case?
I'm just gonna take an L, honestly.
Hmm.
It's 180 marks, right? Like, so if I miss like one or two MCQ questions, that's 1%. Like, I'm not too fussed.
Okay.
I'm just trying to make
Fair.
sure that I get everything else right, as well as like definitely making sure that the repeated questions I get right.
Yeah, 100%. I mean, I feel like my
Because
deck
like,
covers.
yeah, like those repeated questions are honestly like it's like 60% of the questions, I think it is.
Hmm.
And then the remaining 40% is going to be where you differentiate it.
Exactly. Yeah, 100%. Yeah. That's the main thing I was thinking about. I mean, I guess Blue Link is gonna be easy. I mean, Blue Link ain't that hard. You can just go through that. Um, yeah. I find even with my deck, like I put in the repeated questions and it really helped like clarify which is the most likely ones they're gonna repeat in this
Yeah,
upcoming exam. Eh?
agreed. Yeah, definitely. Oh yeah, but unfortunately, this one didn't spit out any anatomy questions for that one, but that's okay.
What is this year, bro? Anatomy really comes in week 4, bro. I guess week 1 the heart stuff, and then week 4.
Yeah, it didn't ask any hard stuff. But that's okay. We're
Yeah,
gonna go through this one shortly.
good, good.
Yeah, I'm just getting my GPT now. I want to see the exact like percentage.
What's up? What do you mean?
Oh, I'm just getting my GPT to see what the proportion of repeated questions in MCQ is.
Oh,
I have a really good relationship with my GPT.
good, good. It's like having
Poor
a good girlfriend.
poor Jareer's GPT.
What do you mean, bro? What happened to Jiru?
It's like an abusive
Jareer?
relationship.
Wait, what happened?
Jareer's chat GPT. This is an abusive relationship.
Also, I got the learning objectives. I have everything you need now.
Lovely.
So,
Wait, let me just. My GPT's cooking. It's checking what the percentage is. Yeah, my GPT says it's probably closer to 60%
what?
of repeated questions.
Oh, on that final.
Yeah, for MCQ.
Yeah.
For 2024 PPH/PPD, all 21 known MCQs were repeated.
Damn. And Nick, you have them all in your deck, right?
Yep.
Let's
Bro, I'm
go.
locked in, bro. That deck, I'm finishing it today.
I noticed that
In-
something is there. So in the SAQ, they had some of the MCQ questions put in. So I think they
Yeah, I saw
might,
that. Weird.
yeah, they
Yeah.
might like flip one or two questions in. If you go through the SAQ deck too, it's good.
Mm.
I
Alright, let's
remember
get.
enough of the SAQ deck, so if I see it on an MCQ, I can get it.
Yeah, like
Fair.
you're not gonna figure that stuff over a week.
Yeah.
Alright, let's do this one. A biopsy of intestinal mucosa shows numerous cells with abundant rough endoplasmic reticulum and a well-developed Golgi apparatus.
All right,
Specialized
that sounds
for-
right.
Protein. Lovely. I want to read this. Yeah, A.
Okay.
Question 2. Yeah, squamous.
Yeah. Which one is that? It's B?
Yeah. Question 3.
Oh, I'm getting a call. I'll probably deny it. 3. If A.
Yep. 4.
Marathon.
With chromatids attached at the centromere, aligned on the equatorial plate, metaphase.
C, right?
Yeah. Trisomy 21 due to non-disjunction in gametogenesis. At which stage is meiotic non-disjunction most commonly thought to occur?
Non-disjunction? B.
Yeah,
1 sec. Alip's calling me.
that's all right. I'll wait for you. Yeah, my GPT straight up says like 60 to 80%. Can you explain question 5, Shahab? Ah, he dropped out. Okay, I actually want to learn this one because this one has. I understand why it's B, but I don't know.
Okay. The reason why it's B is because majority of Down syndrome cases occur maternally, and age plays a role in it. And then, like, the separation of the chromosome, not independent assortment, the other one. It happens in anaphase. So that's when they get separated into the other sides. And then because it starts to be 21, you're getting that extra chromosome going to one of them.
It's
Does that make
mosaic.
sense?
Yeah. I get it. Cool. All right. Diploid.
Yeah.
This is
Top 5 plus 18.
aneuploidy with trisomy.
Yeah. That's what I'm thinking too, because it was plus 18. That means there's an extra 18.
Yeah. Is 18 Edwards or Patau's?
No clue.
I think it's Edwards. Edwards, yeah. Lovely. In classical Mendelian genetics, how is an allele best defined? Yeah. Researcher deletes what has finds that the transcription is markedly reduced, which has most likely been removed. Probably the
B.
promoter signal. Yeah. D is meant to be removed, so
I have 3. E is also meant to be removed.
yeah, so that doesn't make sense. A mutation prevents removal of introns from a pre-mRNA, leading to an abnormally large protein. This mutation has most directly interfered with which process?
Splicing.
Splicing, yeah. A first year student is shown the shoulder joint and asked why. I hate the shoulder, bro. Why such a joint allows multi-axial movement? It is a ball and socket synovial.
Great.
A muscle sample shows striations and branching fibers with intercalcated discs, cardiac.
Blue.
A patient has referred knee pain from irritation of the hip joint. Which principle explains this pattern?
C.
Or yeah. Yep. A histology slide of loose connective tissue shows abundant ground substance rich in long unbranched polysaccharide. This is glycosaminoglycans.
B.
Yeah.
Yeah.
I actually really like glycosaminoglycans. That's like the only part of histology I like.
Oh.
The basal lamina of an epithelium is thickened in a diabetic patient, which is the main structural component of the basement membrane. B. Yep. Type 4 collagen and laminin. In intermediary metabolism, which statement about metabolic pathways is correct? Pathways are strictly no.
I read B. That sounds about right.
B. Kinase transfers a phosphate group from ATP to a regulatory enzyme, altering its activity. This is phosphorylation. Do you agree?
Yeah. I'm sorry. I'm munching on these biscuits.
Oh, good. A biochemistry tutor says some steps in glycolysis are easily reversible. Others are essentially one way, which thermodynamic feature mainly distinguishes the essentially irreversible steps. It's B.
B.
Yeah.
Shouldn't it have a large positive?
Nope. If a reaction is spontaneous in the forward direction, it has a negative Gibbs free energy.
But isn't it mainly distinguishes the essentially irreversible step?
Yeah, which means that you can't go back. So irreversible step will be always spontaneous in the forward direction, and it'll be massively spontaneous in the forward direction. So therefore, Gibbs free energy is negative, as you can see. Come on, bro! Don't argue with the physicists on this.
No, I'm just asking because I want to know like.
Yeah, so
where
it's
my
actually
logic is going.
So G is actually the opposite to S. So entropy is S, G is Gibbs. The second law of thermodynamics states that the universe must increase in entropy, so delta S is greater than 0 for mainly most reactions. But then Gibbs free energy is the opposite, so it must be less than 0.
Easy. Thank you.
Oh, good. During oxidative metabolism of glucose, where is the majority of ATP actually generated? C. Agreed?
Yeah. Sorry.
Yeah, I can't see, so I don't know. Yeah. A couple has a child with Down syndrome due to Robertsonian translocation involving chromosome 21 in the mother, which is the most accurate counseling point regarding recurrence risk. Well, it's Robertsonian translocation, which means that it is passable. It's inheritable.
Yeah.
So it will be
B.
Yeah.
No.
Oh, actually,
I'm thinking D sounds good. Oh no, that's wrong because it occurs only after age of 40. That doesn't make any sense.
yeah. I think it's B.
Yeah, B makes the most sense to me.
Yeah. Recurrence occurs only if both parents carry the translocation. We know that's subjectively wrong based on the PBL that we did.
Yep.
National data shows that the prevalence of Down syndrome rises with maternal age, which is the most plausible explanation.
I put C.
Yeah, I agree with that. A doctor is explaining the biopsychosocial model to a medical student. Which scenario best illustrates this model? B. Yep. Two patients had the same degree of knee osteoarthritis on X-ray. One reports severe disability, the other minimal symptoms. Why? B.
Yeah, agreed.
A junior student is asked to outline the usual structure of a medical consultation. Which step is essential early to establish rapport and direction?
B.
Yeah. What do you mean, bro? It's absolutely A.
Bro, I'm sorry, bro. You're right.
A patient presents with developmental delay and a sibling with the same problem. To construct a pedigree, which of the following must be obtained? B.
B. Yeah.
A pharmacology lecture defines what the drug does to the body. That's pharmacodynamics. Yeah. A full agonist, a second drug binds the same receptor but produces a smaller effect. So the second drug is a partial agonist. A dose response curve for the drug is shifted to the right in the presence of another drug, but the maximal response is unchanged. This is competitive antagonism.
Yeah, agreed. C.
Two drugs produce the same maximal effect, but X requires a lower, so X is higher potency, so B.
Yeah.
A student notes that acute stress before an exam increase alertness and performance. This is B.
B.
Yep. A resident sees a carer with long-standing high caregiving demands, insomnia, and recurrent infections. Which is the most likely health effect of chronic stress? B.
Yeah, agreed.
During meiosis 1, homologous chromosomes fail to separate, but sister chromatids stay together. Which statement is correct? All gametes will be diploid. What?
No.
No.
B.
Yeah. Yeah, because they fail to separate.
Yep.
Yeah, so that's your non-disjunction right there. Crossing over normally occurs in human meiosis. What is the main significance? C.
C.
Yeah. Independent assortment is metaphase.
Yeah.
Pedigree shows affected males in every generation, male to male transmission, and affected females when heterozygotes. Which, yeah, because they only have one chromosome, one X chromosome. Two healthy patients have one child with autosomal recessive disorder. What is the chance that the next child will also be affected? A quarter.
No.
Oh, wait.
Draw it out.
No, wait. It doesn't say. But are the parents have to be carriers, so it's a quarter. Yeah, it's a quarter. Both parents have to be carriers. Think about it.
Yeah, no, it is a quarter. I agree.
Good. A lab report describes simple columnar epithelium with microvilli and goblet cells from the small intestine. Which is most characteristics of this epithelium? B.
I heard B.
A histology slide shows long multinucleated fibers with peripheral nuclei skeletal.
A.
Yep. A section of loose connective tissue shows spindle that synthesize collagen and ground substance fibroblasts.
B.
A patient has a disorder of proteoglycan synthesis. What function of connective tissue is most likely affected? B.
Yeah, agreed.
A molecular biologist shows a gene with exons interrupted by introns or controlled by a promoter and regulatory elements upstream, which is the correct term for this organization. So this is
B.
Yeah. Like, what? Yeah. If they said okay, B could be replaced by the primary transcript in the exam, though.
True.
So if it said primary transcript, obviously, it'd be different. A transcription factor binds to an upstream regulatory element and increases the rate of mRNA synthesis. This is an example of
Positive
A.
regulation of gene expression.
A. A newborn, this is obviously Downs.
See?
Yep. The parents of a child with Down syndrome ask which supports are available. Which is the most accurate first response? C.
Yeah,
That's a bit mean.
none exist in Australia. Crazy.
In taking a genetic history, the student is unsure whether to document miscarriages and stillbirths. Absolutely. Yes, absolutely. A clinician explains the atlantoaxial joint is a pivot point, pivot whilst, okay.
Range. Oh, joint shapes determine range type of movement.
Yeah, that's what it can be. On the neuroanatomy exam, a student is asked which spinal nerve root dermatome supplies the thumb. C6.
Nah, bro. I think the answer is S1. S4 actually.
Oh yeah. If my finger is down there, it might be S4.
100%.
For translation, some proteins have sugars added in the Golgi apparatus before secretion, which this is
Post-translational modification.
Yeah. So B, in oxidative metabolism, which statement is correct about ATP yield from complete oxidation of glucose?
I read B. Sounds right.
Yes, absolutely. Yeah, I'll go with that. Yep. A karyotype of a newborn shows 45 chromosomes due to the loss of one. This is
Wait,
aneuploid.
what was your? Okay. Yeah, sorry. Okay, it's C. Easy.
Yep. A concept check asks a cell that has a integral multiple of a haploid is best described as a
What the fuck?
euploid.
And Euclid?
Yeah.
Okay, yeah, easy.
So remember, a haploid has N, a diploid has 2N.
And yeah,
Euploid is just like a number times N.
about that. It's a complete set of chromosomes. Okay.
You want to go through this?
Yeah, easy. I am quickly just pulling up the answers. I'm organizing my screen. So A is
Yep.
first.
Yep.
B, A,
Yep.
C.
Just list them out. I'll tell you to stop.
Okay. B, 5B, 6A, 7C, 8A, 9B, 10B, 11A, 12B, 13C, 14, 15, and 16 are all B. 17C, 18B, 19C, 20B, 21C, 22 to 25 are B. 26 is A. 27 and 28 are C. 29 to 32 are B. 33 is C. 34 is A. 35 is B. 36 is B. 37 is A. 38, 39, and 40 are B. 41 is A. 42 to 44 are C. 45 is B. 46 is A. B, B, C, C. All right, we got perfect on that.
We got 34 wrong.
Oh, 34?
Yeah, 34.
34 was A.
It says the answer is B.
Okay, easy. What's 34?
Obviously wrong.
What the fuck?
This is not autosomal dominant. That's not how that works.
Wait. Affects males in every generation? Yeah, no, that's fucking incorrect, bro. What is that?
Yep, affected females when heterozygotes. So no, it wouldn't matter.
Agreed.
Good. Let's keep going. I will GPT that or Gemini that. Why not? Just to be safe. What? Heterozygous are unaffected carriers. That makes sense though, because obviously females have two X's. So if it's X-linked recessive, it wouldn't affect heterozygous females.
Oh, I see what you're saying. Pedigree shows affected males in every generation. Male-to-male transmission in affected females. Okay, when heterozygous, the females are still affected.
Yeah,
Alright,
so it
now
has
that's
to
what.
be dominant. Now, why isn't it X-linked dominant? Because fathers can't pass it on to their son. Yeah. Because the X comes from the mother. Right. So therefore it
Oh,
can't.
male. Oh, that's. Fuck,
Yeah,
that's on me,
it's just
bro.
straight up can't be X-linked at all. X-linked isn't X-linked mothers to son.
Mother. Yeah, it's mother to
Yeah,
son.
we had it the wrong way around. That's okay. We're learning. But still, 49 out of 50 is pretty good. You ready for week 4?
I'm locked in.
All right. Question 1. Researcher measures the initial velocity of the enzyme catalyzed reaction at several substrate
Oh, give me
concentrations.
1 sec. I gotta quickly set it up before question
She
1. Okay, easy.
then adds a competitive inhibitor. The Vmax is unchanged, but a higher substrate concentration is needed to reach half of Vmax. Which parameter has definitely increased?
Apparent KM.
No. Oh, yes. Yeah, because we have lower affinity now. Yeah. In a biochemistry Viva, you've asked which statement about delta G is most accurate. No. Yep.
Okay, easy. C.
Yep. Yeah, technically that, but it says most accurate, so yeah, I suppose. A mutation alters the active site of an enzyme so that substrate binding is still possible, but the catalytic step is slower on the MM plot, which will change.
C. KM unchanged. Vmax.
Yeah, I agree with that. Yeah. A patient presents with a non-healing abrasion on the forearm. Histology shows loss of the epidermal layer composed of stratified squamous. This layer primarily arises from which skin component?
Epidermis derived from keratinocytes.
Yeah. Yeah, particularly in the basal layer. A biopsy from sun-exposed skin shows a dense, irregular connective tissue layer containing collagen bundles. This is the
E.
reticular dermis. Yeah. Papillary is too high up. A 6-year-old boy presents with recurrent skin infections, intact neutrophils, but poor phagocytes. What is normally the first physical barrier preventing microbial entry of the skin? A. Yeah. A neutrophil recognizes opponized bacteria and engulfs them, which is most important in opponization. B.
Yeah, agreed.
A viral infected cell is identified and killed without prior sensitization by a lymphocyte that contains cytotoxic granules, but lacks antigen-specific receptors. So
C.
is a natural killer cell. Yeah. A child cuts his finger. Within minutes, local mast cells and tissue macrophages release mediators that allow plasma proteins. It's the initial vaccine change. Yeah. So that's how we get the histamine release.
Yeah.
Which situation requires contact plus standard precautions?
What? D?
I don't think we've learned all these.
Heavy environmental contamination.
Probably D.
Bro, yeah, I'm thinking D. I read MRSA and I'm like, that's the worst one.
Well, because it's specifically contact. Obviously, these aren't contact. This is not. Oh, that's not contact. Yeah, probably this one.
Yeah.
All right. Primary abductor supraspinatus.
Yeah.
Weakness of elbow flexion and supination. Which is most likely affected? Musculocutaneous.
Wait. What was 11?
B.
B. Isn't it beyond 15?
Whoa. It's the deltoid. Rock climber has pain beyond 15 degrees, which is the primary abductor after initiation. Supraspinatus initiates, so it's deltoid.
Agreed.
Yeah, this is a tricky question. A patient has weakness of elbow flexion and supination, obviously musculocutaneous.
Agreed.
A 4 on the outstretched hand results in anatomical snuff box tenderness. Which carpal bone is the scaphoid?
Agreed.
Tennis elbow is due to overuse of which forearm muscle group? Oh, wow, I wonder. D.
Agreed.
In carpal tunnel syndrome, there is a numbness of the lateral 3.5 digits and the weakness of the thumb opposition. This is obviously the median nerve.
I disagree. I think the answer is A, like Green's canal, 100%.
Absolutely. That's why it's called
Yeah.
carpal tunnel.
Exactly.
tunnel.
And it's not called Green's canal syndrome.
A cell maintains intracellular low sodium and high potassium, even though it's against concentration gradients. A, very easy. A hormone increases the number of glucose transporters on the cell surface, allowing glucose. This is facilitated diffusion.
Yeah.
A cell is placed in a solution where the electrochemical gradient of K is outward, but K cannot leave because its channel is closed. Opening the channel allows K to move until its equilibrium potential is reached. This is an example of, after an overnight fast, 10-month-old becomes pale. 2.1 for raising blood glucose, obviously. Yeah. A child is down von Gerk, which biochemical defect best describes the current hypoglycemia. C.
C? Yeah, no, I agree with that actually.
Well, it's the complete opposite. This is glycogen synthase.
Yeah, no, I didn't read any of the other ones. It's fine.
All right. In managing hypo due to hepatic glycogenolysis defect, which dietary advice is most helpful? A.
Yeah, agreed. A. I remember giving cornstarch to that guy.
Yeah. A pharmacologist describes drugs that act by binding to ion channels and preventing ion flow. Which mechanism of drugs action is this?
Is this B?
B.
Blocking
Yeah.
ion channel. What type of fucking question is that, bro?
Well, look, okay. There's some dozen here, but there's a lot of good stuff as well.
I agree.
Captopril reduces blood pressure by inhibiting angiotensin. So it's an ACE inhibitor. This is best
Yeah,
described as C. Yep. A drug blocks the sodium chloride symporter, increasing excretion. By classification that we've studied, this is D.
D?
Oh,
Yeah.
oh, wait, it's carrier protein.
Symporter, enzyme. It's not enzyme.
It's C.
Receptor antagonism. Ion channel blockade.
Yeah.
But it's not a is it? Is it a channel? No, it is a channel because we're moving it both in the same direction.
Yeah, you're exchanging.
Yeah, no, I agree. I think it's C.
Yeah. A mother asks why her 3-year-old's history differs from that of an adult. Which of the following is specific to pediatric developmental
C.
birth? Yeah. A video of an unusual rash with the child's face visible. Oh, that's not good.
A.
Medical school wants students to recognize that some groups systematically experience worse health. This is social justice.
B.
You're shown a line graph of daily blood glucose in a patient with recurrent hypoglycemia. The lowest point falls around 3 a.m., which is the most appropriate intervention step.
Wait, what?
What?
I'll say B.
Yeah. Oh, because remember we had graph reading that week.
Yeah, easy. You always read the X and Y first.
Do A, bro. What do you mean?
Oh, true. Always A.
Yeah. A patient with a deep laceration shows no signs of infection 24 hours later. Which component of innate immunity at the wound site likely helped prevent infection?
C.
C. Yeah.
Oh, 2028 is C, right? I accidentally put BC.
B and then C. Yeah.
29 is C.
Yep.
B for 28, right?
Yeah. Defensins and
fine.
other small cationic peptides mainly act to.
B.
Yeah. A patient has an AC joint separation. Which articulation is directly involved? What?
Clavicle with
Yeah, like.
nah. Clavicle. Nah. Oh, A.
What is this question? Come on. But to be fair, I made a lot of dumb mistakes in SAQ.
Yeah.
After a supracondylar fracture of the humerus, a child cannot oppose the thumb and index finger. This is the
Median nerve.
medial nerve, yeah.
Nick, you're muted.
A medical scientist measures an enzyme's Vmax and
I'm talking to
Km,
my girlfriend. I'll be back.
Oh, easy.
then adds a non-competitive inhibitor, which is changed. Non-competitive is the other way
Vmax.
around. Yeah, Vmax
Yeah.
decreases, but Km is unchanged.
Yeah, so C.
Yeah.
33C.
Yep.
Wait, what? Just whoa. I think Alessandro. What happened here, boss? Yo, we're just getting in the rhythm of things. That's crazy. Hmm. Let's check this out. About early moments. What happened here, bro?
Sorry, I dropped out there.
Not easy.
Let's keep going. I said that 34 was D.
34. Give me one sec. I am coming to you. 34 is. Yeah, dense irregular collagen bundles. 34D.
Yeah, it's the only one that makes sense because the thicker dermis.
Easy.
35, seizures during fasting, hepatomegaly, and lactic acidosis. Oh wow, night starvation.
Night starvation. C.
Yeah. Oh wait, no,
This
it
is
has to
not
be C. It can't be C.
hepatic like a defect in which is most considered with night starvation.
Oh, a defect with, my bad, sorry. I thought this was saying what is happening here. Yeah, nice. A drug that binds to a receptor and produces the same maximal effect as the endogenous ligand, but as a lower concentration, is said to have.
A.
Yeah. A drug achieves its therapeutic effect by binding to a GPCR and activating a second messenger cascade. This is.
B.
Yeah, receptor simulation. I don't even get that question. A trial with suspected carpal tunnel, rare but possible in mucopolysaccharoid. Don't know what that is tested for sensation over the thenar eminence. This area is spared because it is supplied by the thenar is the ulnar nerve. No, a radial nerve. C.
C. Radial nerve? I don't know. I wouldn't know that, to be honest.
I'm gonna look this one
I
up
would've-
actually.
Lateral antebrachial. So sensation? Maybe lateral antebrachial cutaneous? I don't know.
No, but that's not the thema eminence. I don't think it is. I'm willing to take the L here, but I don't know. How is it the cutaneous branch? There doesn't.
Boy, it doesn't make
So-
sense though.
So we suspect that it's
Proximal to tunnel,
so we test an area, and this area is spared because it's supplied by the medial nerve
which is
Ah,
proximal.
to the tunnel, so it doesn't enter the tunnel. Right. That's fair. So basically, it's saying we've identified that there's an issue with the median nerve, but we don't know if it's in the carpal tunnel or if it's before the carpal tunnel. So they test the thing prior to the carpal tunnel. But I didn't even know that was the case. I didn't know that this palmar cutaneous branch of the median nerve existed.
Bro, I don't know either, bro. I've never heard of the palmar cutaneous branch before, but it sounds like a nerve to me.
That's okay. I'm happy to take the L there.
I
But you
agree.
don't know. It could be asked. High yield question.
True.
Make a note of it. 38.
38?
Yeah.
38.
Oh, I have it here. That's all right. Don't worry. That's all right.
Wait, okay.
I'll send you the link
35,
to this order.
38 is C, right?
Yeah. 38 is B.
38
said-
is B.
I said C because the
Okay,
Athena
what was 37?
37 was B.
36?
That was A.
Okay, all right. I thought I messed something up. So 38 is B.
Yep.
39, we have
I got that wrong though. Yeah. 39. Insulin stimulates GLUT4 translocation down its gradient. This is
C.
C. Yeah. Oh wait, hang on. No, but facilitated diffusion is it moves down its gradient. Yeah, my bad. A 9-month-old with von Gerks is managed with frequent feeds and avoidance of fasting. This C.
Yeah, agreed.
In a pediatric consultation, the doctor first asks the parents for the child's presenting problem, then seeks perinatal. A.
Yeah.
A student posts an anonymous but still identifiable clinical photo from the ward to social media without permission. Which element of professionalism is most clearly violated?
A.
A community clinic implements bulk billing, extended GP services, and transport vouchers. This policy is most
B.
consistent with B. You're shown a bar chart of skin cancer. B.
Yeah.
A child presents with cellulitis around a small abrasion. Which innate immune mechanism is most directly responsible for the killing of engulfed? This is
C.
Yes. Yeah. 19-year-old sustains a mid. This is radial nerve.
Agreed. Yeah. Mid shaft, strap, right on it.
Yeah. A 42-year-old woman has weakness in finger abduction and sensory loss at the medial one.
Ulnar.
Yeah. Neutrophils showed defective production of superoxide. Which antimicrobial mechanism is impaired? B.
Yeah. Respiratory burst.
A woman with long-term type 1 becomes confused at 3 a.m., which is most likely B. C, sorry,
Yep.
my bad. Yeah, not B.
C.
A new local anesthetic blocks voltage-gated sodium channels in peripheral nerves to produce loss of pain sensation. This is C.
Okay, agreed. I had C down as well. All right. 1A,
Yep.
2C,
Yep.
3C, 4D, E for 5, 6A, 7B,
Just say the letter.
8, C, C, D, A, B, C, D, D, A, B, C, 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 A, B, C, 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 A, B, B, C, B, A, B, C, D, C, A, B, B, C, C, A, B, B, C, A, B, B, C, C. What did we get
Yeah.
wrong?
Got 9 and 24. So 9 it says D, and 24 it says D as well. So 9 is
Oh, wait, what?
no, that doesn't make sense. You don't have platelet aggregation initially in acute inflammatory response. That's wrong.
Yeah, I agree. It's vascular permeability of post-capillary venules.
Yep.
24?
Yep, 24 it says D as well.
D? Wait, what?
We spoke about this one earlier.
Yeah, I remember.
Yeah. So a symporter is a transport protein. Okay, I didn't know that. I thought a symporter was just a ion channel, but it actually is a protein. So a symporter is a carrier or a transport protein. I've learned something today. That's good.
Right, I'm gonna set up for 5. But what I'm gonna do is I'm gonna quickly come go spit out my gum and come back.
That's so good. But it is good.
It'll take me like less than.
I think we're doing 3 every hour, which is pretty good.
I agree.
So we should hopefully get to, week 20 by midnight. Hopefully we can get a little bit quicker.
Yes, sir. Literally give me like less than a minute.
Oh.
Walking into her room. Spitting out my gum.
Oh yeah, can you send
Back.
me the learning outcomes?
I can't right now because it's on WhatsApp. My phone is
Easy.
off and I can't. And because this is a new Mac, like I can't log on to WhatsApp on this yet.
All good. All right, you ready?
Oh, just one more thing I need to throw up. Give me one. So quicker. Putting it in. Okay, I am ready.
Question 1.
Ceftriaxone. Oh,
Beta
what?
lactams.
Okay, easy.
The survival of bacteria in the presence of beta lactams. A.
A, agree. A. The answer is A.
Oral doxycycline, the practice. Human ethics plus. Give me a section hub.
Yeah, easy. Okay. GP treats a patient with community-acquired pneumonia using tetracycline. The practice laboratory reports that local hemophilus influenza isolates have been accumulate efflux pumps that is the main effect of the resistance mechanism. The answer is B. Yeah. 3 is a patient with infective diarrhea has a stool culture that grows a gram-negative bacillus. Laboratory notes say that organism is resistant to fluoroquinolones because of GARA-A mutation. Which bacterial target has been altered? A. 4. A microbiologist wants to know whether a Staph aureus isolate is susceptible to vancomycin. Yeah, A. 5. A hospital outbreak is suspected to be caused by an ESBL producing Enterobacterales species. Which empiric antibiotic class is most likely to retain activity against such ESBL producers before susceptible. What?
Skip. We do not know that.
First generation cephalosporins. No. Trimethoprim alone?
We don't know.
Nah, what the hell is that? I've never seen that before in my life. 5, skip, 6.
We don't know, but I'm curious to see what it says. Yeah, no.
Yeah,
there's
that's the only one that made. Bro, what the hell is a carbo what?
I don't know.
Carbapinamines?
Let's move on. I'm gonna mute myself again. I got dinner here.
A virology seminar describes rhinovirus, adenovirus, influenza, RSV, and parainfluenza as common respiratory pathogens. Which of the following best explains why influenza causes more? Influenza infects and damages lower and conduces viremia. And therefore, yeah, no, that's the only one that makes sense. A. 7. 5-year-old presents with barking cough and inspiratory stridor in winter. The likely agent is a perimyxovirus infecting upper areas. Which virus fits this profile? 7. Let me read that. Parainfluenza. Perimyxovirus. Is it parainfluenza?
Yeah, remember, paramyxoviruses are just influenza.
Yeah, easy.
I think.
I think. Can you put that in thing?
Yeah,
Because I'm pretty sure it's parainfluenza. Because I know influenza is orthomyxoviridae.
Yeah, and then orthomyxory is the RSV. Yeah. All right, we'll go back. I'm just gonna mute myself again.
A 32-year-old nurse acquires an influenza infection. Which step is the viral replication is the main target of neuraminidase inhibitors such as what the bro? When did we learn about neuraminidase inhibitors, bro? Skip that question. Patient is started on amoxicillin plus clavulin, inhibits beta-lactams. I didn't read any of the other ones. I'm putting that A. Let me know if I'm wrong there. A woman on long-term broad-spectrum antibiotics develops diarrhea, stool culture for common bacterial enteric path. Have you suspect a toxic-producing organism that they're no, it's Difficile. A. Medical students asked why bacteria are generally more susceptible than humans. Cells to cell one. What does it mean? I would say A. Wait. Can you go up? Yeah, agreed. It's A. Tested it blocks transpeptidase. This makes it function more similar to penicillin. 63-year-old man with COPD presents with increased sputum volume, purulence, and breathlessness. You distinguish an acute infective exacerbation. Which of the following clinical features must help to green sputum, purulent green sputum. A. Review an adult with high fevers, rigors, lobar consolidation season. These findings are most lobar pneumonia. I was about to say pneumonia. B 14 15B 14B 15 we haven't done yet. Sorry, yeah, it's A. My bad, I read that wrong. I knew the answer is pneumonia. 15 is a doctor wants to confirm mycoplasma pneumonia as the cause of atypical pneumonia. Which statement about this pathogen is true and relevant to antibiotic? It lacks a peptidoglycan cell wall. Yeah, it's gram-negative, no? Agreed. It's gram-negative. A.
I'm very sure it's gram-negative.
I don't think it's coccus as well.
No, it's not. Well, it's Mycoplasma pneumoniae, so by definition, it has to be gram-negative.
Yeah, agreed. A 72-year-old is started on oral amoxicillin. Which pharmacokinetic process will most directly determine how much of this dose actually reaches the systemic circular oral absorption in the first pass? The drug is the only bioavailability. Wait, no? Yeah, bioavailability B. A. 18 is. A patient takes a very lipid-soluble antibiotic. It is 95% by which statement is more. Only the unbound fraction. A. A researcher notes that a certain antibiotic undergoes extensive first-pass metabolism and therefore has poor oral bioavailability. Which study could improve yet? Give them as drug intravenously. A again. Yo, Alessandro.
Yeah.
Bro, we've gotten A for almost everything except for 2.
That's okay. Let's keep going.
Oh,
I'll take a peek. Never mind. Let's keep going.
that's okay. That's questionable. So
It happens.
20.
It happens. It's okay.
Okay. Bro, if I see this on the exam.
GPT. It tries. It tries its hardest.
Okay. All right. Okay. I just hope we're not fucking up somewhere, but okay. A community pediatrician explains to parents that a single vaccine cannot protect against all viral respiratory infections in winter because different. Okay, A again. 21. The public health officer compares a number of A. The measles outbreak, 40 new cases occur in a school of 800 over 2 weeks. If 800 were at risk at the start, what does 40 over 800 represent? Period prevalence over cumulative incidence over the incidence rate. No, it's not. It's cumulative incidence over the period. The year. Wait, over the period? Can you go up again? Yeah, agreed. A. 23. If student says because prevalence is high, incidence must be high, which situation clearly shows chronic lifelong infection? Well, yeah, A. Agreed. Bro, I'm just gonna put A for all the answers, bro. Like, a patient refuses a bronchoscopy. Bro, I'm not gonna read it. It's A. 25. Registrars can need consent. A again. Okay. 26. A microbiome explains to students how bacteria cause death, disease. Which description best captures the host? Yeah, no, the answer is A. Gram-positive coccus is found to express as polysaccharide capsule that inhibits phagocytosis. This virulence factor helps the organism by A. Which of the following best distinguished bacteria from human cells often target? A again.
What's wrong? What's wrong, Shahab?
Bro, we've got an A for everything. That's what's wrong.
All right,
Like,
let me
if
just.
you. No, don't look at it. Let's no, don't look at it. Let's go through
I'm
it and
looking
see.
at, I'm
Let's
looking
go
at the
through.
next exam. The next exam is not like this, okay?
Maybe we're just fucking up somewhere. I don't know. I don't even want to look. Okay, no, I see. I
What
think
exam? What question are we up to?
29. 19 Aboriginal patient presents with a respiratory infection, which is the most appropriate. 30. A patient refuses routine administration. Boy sustains a tibial fracture in sport during exam. He cannot dorsiflex the foot, has reduced sensation, defibrillator. Hip disorder, patient cannot extend the knee and has lost sensation of the anterior medial. Yeah, more on Earth. A again. 33. A footballer has posterior cruciate, which is a key clinical test sign, posterior drawer section. My goodness, what the fuck is this? 34. One sec. Yeah. 28-year-old woman has recurrent ankle surgery inversion injuries, which ligaments of motion ankle inversion. I don't know this one, to be honest. Is it A?
So if you look at the feet, right, we're not really meant to know the feet, but this is on the bottom of the foot. This is obviously the knee.
Yeah.
This, I don't know where this exists. I would imagine it exists somewhere in the popliteal fossa. And then the deltoid ligament, I don't know where that is either. So I'm just going to look up the deltoid ligament.
I think the answer is B. It has to be the deltoid ligament.
Is the medial. So the inner side will be from eversion because you have to roll it out. Whereas
Okay,
the
easy.
other one will be from inversion.
Easy. Adducted thigh, loss of the medial thigh obturator nerve. Yeah, medial loss, sensory loss, abduct, obturator nerve. No, yeah. Okay. There's no such thing as a superior gemellus nerve, so that's A. It's 36 is A. 2 antibiotics, both kill SMRE, drug X is more potent. So drug Wait, is more potent? Oh, okay, no, I read it wrong. Wait, drug X achieves the same. Wait, go up. Drug X achieves the same effect at 50 mg as drug Y doses at 200. Oh yeah, it's A. Okay, 37A, 38. Let me just put that down. A patient takes an oral antibiotic that is a weak base. In stem features mostly ionized. Will reduce lipid soluble answer is A. Long course of broad spectrum antibiotics leads to vaginal candida. Yes, with a yeah, A. Which statement is correct? Read A. I think it's A. What the mother of law? What fuck, bro? That's math. She needs to define how many people in the population had disease at a single point, 10-point prevalence. Cluster reported unexpected cluster of several adenovirus. The PHU wants to determine if this virus is actually causing the illness or just present. Which class is association? Yeah, Bradford criteria. It's always causation. For your Aboriginal, I'm not even gonna look at it. The answer is A. I read culturally safe language use. 24, 25-year-old man presents structured communication respiratory exam. That's right. I'm not even gonna read it. A. 46. So yeah, A again. I didn't even read it, but 58-year-old received gentamicin. Yeah, okay, through Uganda. Lab strain of course. A. Just gonna put A for all of them. I don't even care anymore. A. 48. Answer is A. Okay, let's go.
All right. So everything is A except question 2, which is B. And that's it. What do you get?
No, we got everything right.
You said there were 2 questions that we didn't put A for.
No, we put A for everything except question 2 is what I said. And then we skipped question 5 and question 8.
Oh, okay. No problem. Let me just check. Okay, so that was just a ChatGPT illusion. All right, let's go. You ready? You can see, like I said, spread the answers randomly and evenly between A to E. Like, what do you want me to say?
No, you did your job, bro. Just give me 1 second, because
Nick, where are you? Why are you in like a... What's your background?
Brother, dinner. Miso soup. Oh, I can't move it. Miso soup. Spoon.
Oh, I thought that was like
rice,
a wall.
pork.
Why is your
No.
background dinner?
is that what you're eating?
Bro, I ate that. That's great.
Damn. Okay, I'm ready.
All right, you're gonna have to keep reading.
Okay. 28-year-old woman presents with a slow, enlarging dome-shaped lesion on her upper back. Histology shows an epidermis of keratinizing, stratified squamous epithelium overlying a thick, dense, irregular tissue with, reticular dermis. Has papules and pustules on his face and upper trunk. You explain that these areas have many hair cells with associated sebaceous glands. These ecrin pilosebaceous. Clinician planning an excision on the cheek wants to minimize scarring and wound differentiation. Isn't it just orientation of relaxed skin tension lines? Am I right or wrong? I don't know. I think I'm right. A four-year-old develops cellulitis after scratching an
No,
insect bite.
I'm 90% sure you're right from that because it's the Langen lines or Langerhans lines, whatever they're called.
Yeah, easy. 4-year-old develops cellulitis after scratching an insect bite. Culture grows Staph aureus. That is also found under normal skin. D.
Sorry, just keep going. I'm lagging for some reasons.
Easy. A patient's skin swab grows coagulates negative staphylococci without any clinical significance of signs of infection. Most appropriate. E. Staph.
Oh, wait, I'm back. Sorry. What question are we on?
5. I put E down for 5.
B. Yeah.
D.
Yep. E. Yeah. E. Yeah.
The drug is 98% bound to plasma albumin. A second drug displaces it, doubling the free fraction, which seems most. Yeah, okay. A is the answer. Pedophilic drug needs to cross the blood-brain barrier. Which factor most strongly favors its entry to the brain? High liposoluble, low protein binding. A. 8. Oh wait,
Yeah.
what? Which factor most strongly favors its entry into the brain? Wouldn't it be A?
Yeah.
8.
Yeah.
A pro-drug for acne is given orally and has little effect until metabolism, or is it bioactivation during drug metabolism?
Has little effect. This is a pro-drug.
Yeah.
So yeah. So C. Yeah.
Throwing inducer, she's also which is cleared mainly by CYP3 or 4. After several drug phyllo falls and its effect is reduced. What is the most likely? Wait, what? So takes drug X, strong inducer, drug Y, which the enhanced metabolic clearance by drug.
Hang on. A patient takes X, which is a strong inducer, so it messes with Y, which means that you have increased clearance of Y. So A, yeah.
Yeah.
Yeah, because you can't metabolize it, so it just gets discarded.
Agreed. I put the answer as B. A breastfeeding mother is prescribed a highly lipid-soluble drug with low protein binding and low molecular weight. Which statement best describes the situation? The drug will enter the breast.
Yeah, B. Easy.
17-year-old has multiple chromosomes, inflammatory papules, and pustules over the forehead. Which mechanism most central to drive? Yeah, A. I'm not even going to read the other ones. That's happening. 23-year-old man develops a painful fluctuating lump on his thigh after a small skin break. Pus drains. Yeah, a localized abscess. 13. During a dermatological oscopy, a student examines the entire skin surface, scalp cells. Skip that question. We don't do it. But even then, I'll put B because that's probably right. 14. 10-year-old is brought with an annular scaly plaque on the scalp. Skin jumps straight to treatment without exposures. Right pattern. 15. 20-year-old. Yeah, I put that down. 15. A 21-year-old Aboriginal woman presents with this facial rash. She tends with her aunt to make the consultation culturally appropriate. Yeah, okay, easy. 16. Okay, Aboriginal woman. I'm straight. A is right. Cultural barrier. Anything with culture in it, or what's the other thing? Stolen generation is almost always the answer for. In a case control study on affected skin ulcers, investigators find an odds ratio of 3.0 for not washing hands. So correct cases about 3 times the odds. Yeah, A. Already A is right. 18. An observational study finds an association between the use of a particular soap and lower rates of skin abscess. However, households using the soap are wealthier and have better overall hygiene. This additional factor is best affect socioeconomic status. A public health registrar applies rapid consideration of drug link between a new temporal. Okay, yeah, I agree. Access PBD. PPT. A researcher wants to estimate the relative risk of skin infections in people who use a shared gym compared with those who do not and can follow over time. Prospective cohort. Agreed. A lot of A's, bro. 14 to 20 was all A's. 21. A hospital reviews incident reports and finds several near misses in prescribing topical antibiotics for the wrong patient because of similar names. Okay, I'm putting A down, bro. A student asks why errors occur even in competent dermatology clinics. The tutor explains that. Just gonna put A down. I'm not even gonna read the other ones. A resident is examining an erythromedia plaquing. What is this? Child has recurrent boils caused by Staph aureus that is isolated from his nose. So the organ can persist as normal flora and later develop an invaded broke. Yeah, agreed. It's A. I'm not even gonna read anything else. The answer is A. Yeah, answer is A again. 27, pathologist. She remembers terminal hair follicle solution on the situation for grip and the brain injury. Scalp can now be affected. Like germal bus as most injuries. Scalp is specialized for protection from the sun. Palmer skin. Yeah, no, I'm thinking that's the answer. What is the main functional difference? Yeah, no, I agree. The answer is that 100%. Woman treated with the potent CYP450 inhibitor develops adverse effects from her use. Usual oral metabolic currency being reduced. Agreed. 29. A student compares two graphs. One shows the risk of skin infections over 6 months and an exposed and unexposed. The other shows the proportion affected on a single day. Which statement is correct? Yeah, A. The cross-section shows that 12% of people currently have a fungal which currently has the point. That's point prevalence. Answer is A. 31. In acne, protein continues to be inflammatory in the body. Yeah, agreed. A. Is that A? It's A. 31. 30. Is that 31? Yeah. Okay. 32. A 15-year-old with postural lesions on face and chest is treated with a topical antibiotic. Yeah. Okay. Easy. A. 33. A researcher is assessing whether exposure to new detergent is associated with hand dermatitis. She calculates a risk ratio of 2 and confidence of 95% confidence from 1.4 to 2.6. What does this mean? Exposure so you double the risk. And yeah, agreed. 34. A study finds an association between hair dye use and a rare skin malignancy, but people who use hair dye are also more likely to have frequent sun UV. Which is the best next step? A. A 14-year-old presents with multiple painful nodules after squeezing pimples with unwashed hands. Which host factor? Yeah, disruption of the epithelial barrier. A. Drug that must be converted in the liver, phase 1 oxidation, and then conjugated phase 1. And yeah, no, it's A. So it reads the neonates may be more susceptible to topical drug toxicity. Yeah, agreed. A. And tutorial, A, not even gonna read the next one. In lesion, a student accidentally skips hand hygiene, which fundamental patient routine in hand hygiene with a program. So, Epidinia wants to prevent the risk of infections and offset the with it and without colonized. She calls to group from the start, which incident stopped. Yeah, agreed. Students that the scalp accident growing have abundance of apricot. Yeah, agreed. 10-year-old acne is on a retinoid metabolism 6. She's also taking another drug that inhibits these enzymes. Reduce retinoids, monitor closely for diet A. Case and control study of an occupational chemical. 44. A hospital quality audit shows that in taking dermatological history from a CAL member using a curve. A. A 15-year-old boy has excessive nodular cystic compared with superficial abscesses, multifactor causes involves formula A. An epidemiologist wants to know whether a new skincare program in remote Aboriginal communities before and after. Yeah, A. Drug for skin infection is largely metabolic substituted in an active form of patient has genetic growth, very low substitute. High parent drug level. 40-year-old presents with erythematous crusted lesions. Yeah, A. Multivariable. Okay. Let me read this out to you. A, B, A, D. Wait, what?
It made some BS up. It says the answer is A B C D E A B C D E A B C D E,
Wait, what the fuck?
which is not the case. Okay. I'm gonna plug this into Gemini. Oh, I love when GPT hallucinates. Okay. So 1 is A, 2 is B.
Yeah. Yeah.
I'll read it out. So A, B, A, D, E, A, C, A, B, A, B, A,
1 sec. Yeah, B, A. Everything
Says-
else is A, except for 27.
A. 27 is B.
Then everything else is A.
A. Oh, that's disappointing. Yeah, fair enough. All right,
Okay, we got 12 wrong. 12 is A.
what was 12?
Wait, what?
After a small. Oh, wait, hang on. A non-inflammatory.
It's a fluctuant lump on his thigh, right?
Yeah.
That's a pus, bro.
Oh no, they said D. Sorry, my bad.
Okay.
12 was D. Cool. All right, I'm happy with that.
We're on week 7.
Okay, apparently it says that these are mixed. We'll see. But yeah, week 7.
Okay, can I just quickly take a bit of a break?
Yeah.
What was that? Oh my goodness,
Why-
just A.
My GPT is like talking to me, talking to itself. What?
Start a new
I'm
session, no?
I'm just gonna hide that.
Just, I think it's getting overloaded in that one single page, maybe.
Shush. This is only week 7. Don't don't do this to me. I started preparing for you too.
You're not even done year 1, bro.
What are the 3 most common places for urolithiasis to occur?
Wait, what the fuck is that?
It's
Erythrolyte,
just the 3 constrictions of the ureter for
pelvic, ureteric,
urolithiasis.
vesical, ureteric, pelvic.
Yeah, bit of an L. Anyway, all right, let's keep going. In week 3,
Wait,
of
I gotta go
development,
take a piss, bro. I gotta
Alright.
take a piss.
that's fine.
I'll take less than a minute.
All right, I'm gonna unshare my screen then. You enjoying this, Nick?
Yeah, bro. It's great. Great I'm watching your GPT go crazy, bro.
Yeah. I really stretched mine out this time.
Yeah. All you have to do is meet the token limit, and then you have fully ran through GPT.
Yep.
Yeah.
Excuse me. Bop. Excuse me. I'm very tired. I think I'm just drained more than anything.
Yes, sir.
Bro, Nick, let me know about New Zealand because I just confirmed another guy to come as well.
Okay. Who's going? Who's the other one?
It's Altamash and Adam Choker. They're my buddies who are like third, fourth year med. Like Adam's in Macquarie and Altamash is in Notre Dame, but he going to Melbourne in fourth year.
Yeah, I met Altamash, I believe.
Yeah, easy. Oh, you met Altamash. I don't think you met Adam though.
Yeah.
Are you ready to keep going?
Yes, sir.
Question 1. Let me share my screen.
Oh, yeah, easy. Note accord. I'm not even reading the rest. Unless
Yeah.
8.
You want to laugh? I was hiding this because my GPT started tripping out. Straight up says that like D is correct. Anyway, question 2.
30-year-old woman has bilateral tubular blockage. You explained that this, patency of the uterine tube is needed for sperm and oocyte. One day after fertilization, the conception has a fluid-filled calculate cellular pole. Now a trophoblast, that should be blastocyst. For newborn, has abdominal contents herniating into the base of the amniotic and the cord is closure of the umbilical ring after herniation. Omphalocele, that's the one that has a perennial membrane, and then gastropoiesis is the one without it, and then umbilical hernia is like just has skin stronger. 5, a child is found to have malrotation of the midgut with abnormal position of the cecum and risk of volvulus. This is due to abnormal rotation of the midgut during physiological herniation. See,
Yeah, I agree.
a patient with acute bacterial cholecystitis has a hot, red, swollen gallbladder wall, which immediate arterial vasodilation, increasing local flow. Read 7. Wait, what the fuck?
Yeah,
ICAM 1? No, we never did that, bro.
No.
Can you put that in? I think it's P selected. You know, E selected. My final answer is B. What is it?
C.
Wait, what the fuck? I never heard of beta 2 integrins, bro.
Well, now we know.
19-year-old has tissue necrosis in a leg wound. Histology shows many macrophages, lymphocytes, and proliferant capillaries replacing the exudate. This state chronic granulation tissue formation. B. 8 is. Are we on 8? Okay, no, we skipped. Okay, 8 is D. 9. Okay, let me fix this. 7 cooked. 8D. 9 is a biopsy shows a central area of necrosis. Caseating B. 10. The 7-year-old with chronic peptic ulcers has replacement of damaged tissue, mainly by collagen, namely depressed pill area. This reflects. There's no such thing. Healing fibrosis. Agreed. 11. 6-year-old, 6-week embryo has an epiblast, hypoblast, extraembryo. Which germ layer gives rise to the epithelial lining endoderm? 11? Was that 11? Okay. Failure of the septum, transversum, and pleuroperiton diffuse can lead to herniation of abdominal and viscerated thorax. It's called a GET. B. A 2-week-old embryo has a bilaminar disc and 2 cavities, amniotic and yolk sac. The yolk sac is important in early blood formation and forms part of the gut. From which layer is it lined? Extra embryonic mesoderm. Yeah, hypoblast derived. Should be that one. 55-year-old man develops low consolidating bacterial pneumonia. Within 48 hours, neutrophils filled the alveolar space. Which mediator is particularly important for the recruitment of those neutrophils? Isn't it IL-10 from regulatory T cells?
Yeah,
Whoa,
IL-2
I
doesn't
don't.
make sense.
IL-10 from regulatory,
Oh no, my bad.
isn't it IL
4.
TGF made from platelets?
I don't know what TGF beta is.
Anti-inflammatory, I believe.
Is it an anti-inflammatory?
Ah, it's from macrophages.
Oh, did we learn that?
We've learned about IL-8, but I just never saw it in this context before.
Easy. 14 is
Okay.
easy to learn.
So IL-8 from macrophages is neutrophils. All right. There's some gems in here.
That's right. A patient with a retained foreign body develops a chronic inflammatory reaction characterized by macrophages and lymphocytes with no central necrosis. This is best described as acute suppurative inflammation. Uh,
Oh wait,
is
no,
it
it's
acute
it's a
suppurative?
chronic
No, that
reaction.
yeah. I would think it's non-caseating granulomatous
Yeah,
inflammation.
I agree. Yeah, it jumps there. Deep surgical wounds left open. Okay, this is healing by secondary intention.
Yeah, stuff. Oh, can you tell me the difference between secondary and primary intention again?
Primary intention is you are regenerating. Secondary intention is you are repairing. So it's mainly granulation tissue in secondary intention because you actually cannot replace what was lost because you don't have an intact basement membrane or an intact scaffold.
Okay, easy. Chronic inflammation. Which cell type is responsible for producing the cytokines that activate macrophages and perpetuate the response? CD4, yeah, agreed. A steroid researcher measures CRP and serum amyloid A in patients with excessive tissue injury. Their levels rise within 24 to 48 hours. These are produced mainly by liver in the response to which what? Ivan gamma? Did we learn
Yeah,
this?
no, we absolutely have not learned this. Some people don't even know what CRP means in our cohort. IL-6. Okay.
Yeah, I don't know what CRP meant. Is C-reactive protein?
So IL-6 is for liver. Hepatic response is driven by IL-6.
What's the answer? B?
So A. C.
A.
A, pardon me. Yeah. Okay. The child develops fever, malaise, and elevated ESR, which are the best describes the fever component. D.
PGE2 acting bradykinin causes vasodilation. What's ESR?
Sorry?
I thought it was A. Because it's more of a central nervous system because of malaise.
But it says inflammatory response. Ah, fair enough. Yeah, okay, so Brady, okay, fair enough. I guess I assume that Brady can extend it beyond pain. Good catch.
45-year-old with chronic venous leg ulcer shows slow healing, yet poor supply. 20 is C.
Mhm.
21 is a 28-year-old pregnant woman asks how the placental barrier forms. You spin the maternal blood ultimately. These villi are derived from embryonic ectoderm of the amnion. Wait, you explain the maternal blood Bates fetal chronic chorionic villi.
So the chorionic villi comes from the fetus.
The fetus itself?
Yeah. But I just don't know if it's B or C. I don't know if it's no, it has to be ectoderm. Yeah, I'm pretty sure it's B.
I thought it was C. But you're probably right. I don't know, to be honest. Like, that's a weird part. We never learned about that.
Oh, come on. It's the inner sac. Fair enough. Anyway, but we didn't learn this. That's okay.
Yeah, easy. 5-week-old embryo shows failure of the cranial nerve for the pose. Then the most anencephaly.
Mm-hmm.
B. 23.
No
7-week-old
clue.
that must be divided into urogenital sinus and an anorectal canal fitted with the urorectal septum descent probably can produce. So what the B?
Moving on.
Okay, I'm just gonna put B down, but we'll
What
see.
is this?
Hi, dad, titty form. Hi, dad, titty form or titty form, bro?
Hi, dat itiform.
Hi, dad, tid form. Hi, dad, tid form. What the? Okay, no, I'm skipping this one, bro. I'm not even gonna think about this one. 24. I'll just put cooked.
25's cooked as well.
A neonate presents with meconium distress. Bro, when did we learn this?
We didn't.
Oh, whoa. Chronic
Alright,
H. aggressive factor
H. pylori.
is characterized by simultaneous tissue destruction and repair. 27. A wound culture shows many neutrophils and a thick yellow exudate rich, purulent, thick yellow exudate rich. Yeah. Which one was that? C? D. Okay. 28. Tissue section from a healing wound shows a prolific fibroblasts and loose ECM. Which growth factor center? What? VEGF.
I don't know.
I'm just assuming it's VEGF, but you can check that because of angiogenesis.
Lovely. Vascular endothelial growth factor. Well, obviously that's needed for angiogenesis. Easy.
29. A 4-year-old embryo begins to fold in the craniocaudal and lateral direction. What is the main purpose of lateral folding? 29?
No,
Formation of the neural tube.
I'm not doing 29, bro. What is this?
Can you check? Is the answer A?
We never learned this. It's C.
Well, yeah, no, we never. What the?
30 is D.
Oh, yeah, agreed. D.
Not covered by the amnion. It goes straight into the cavity. Foot ulcer, necrotic tissue, and poor granulation with low albumin, which is most likely impairing his healing.
B.
Impairing? A.
Oh, choo-choo, sorry.
He has low albumin, low protein.
Agreed. Read that right.
A wound that is healed leaves a raised erythem, I can't pronounce that, and remains within the boundary of the original incision and gradually regresses. What is this? Keloid.
Yeah.
Oh, no, wait.
I think that's. Isn't it?
Yeah.
I'm thinking B or A, C.
No,
I
a
think it's
hypertrophic scar goes beyond its margins.
Okay, probably keloid then.
What?
Oh. Right, bro. Guess I was right.
A keloid. Oh, other way. That's so silly. So a keloid does what a hypertrophic scar does. This doesn't make
A what?
sense. So a hypertrophic scar remains within the boundaries and regresses, whereas a keloid grows beyond the original boundary. So it feels like the names have been swapped around here.
Damn, Mr. Locke, that has to be Umair, bro. Nobody else would come up with that stupid of a name.
This corny ass. What is this?
Bro, just change your name to the Sharif of Pakistan, bro. What are you doing?
Bro,
Anyway.
I was watching this stream.
Oh, is that Hamza, bro?
Yeah, bro, it's Hamza.
I thought it was Umair.
Nah, bro.
Okay, we take it back. Everything we said, bro. We love you, Hamza.
Anyway.
saying that this makes sense to be keloid. I was watching the YouTube stream for like 5 minutes. Yeah, this is not keloid, sorry, because keloid extends the boundaries and it's like it grows essentially.
Yeah,
this has
but
to
like that,
scar.
the name hypertrophic scar makes me think of what a keloid scar actually is.
So a hypertrophic scar is the normal scarring that happens, which eventually fades away.
Fair enough. Locked in. All right,
I'm gonna do you
33.
guys like for real in about 5 minutes though.
Oh, okay. A 14-day wound shows a dense collagen-rich scar with fewer vessels. Which enzyme class is critical for remodeling and cross-linking?
C.
Yeah.
33?
Yeah, 33. A 6-week-old embryo has a persistent. I don't know what that is.
Okay, no. Let's attempt this. Median
Allantosis.
Allantois. I remember reading that somewhere.
Please.
It's B or D. I'm gonna say D. Let's check the answer to this one.
Not wasting time. Come on.
Bro, I'm telling you, this could be on the exam.
Okay, what is Allantois?
I forgot what it was. Let's go! Let's go!
A student asks why neutrophils are the first cells to arrive. The best answer is A.
A.
A 25-year-old has a cellulitic leg wound and is treated. 2 days later, there is minimal neutrophilic exudate and no fever. Which cell type is now central in cleaning up? I wonder.
D.
Yeah. A patient with TB has granulomas in the lung. Which T cell subset and cytokine pair is most important for driving
C.
macrophage insertion? C, yeah. A deep laceration of the thigh is sutured on day 3. The wound is filled with granulation tissue and edema fluid. Which event is happening at this stage of healing? It's being filled with granulation and edema fluid. C?
Yeah, no, what's dehiscence? I don't know what the answer is probably D.
So D is...
Doesn't happen, right? What's histence?
Sorry?
What's dehiscence? Wound dehiscence always a thing.
D.
You know, the answer is D, but what is E? Like, what does dehiscence mean?
Oh, I don't know. I don't know what dehiscence is. I thought you were saying D is wrong.
No. I'm saying the answer is D. I just don't know what wound dehiscence always occurs means. My bad, I had a cigarette in my mouth.
Surgical complication where a wound separates or splits open after being closed. So no. A child has... I don't know what this is, but anyway, move on.
Meningeal myelocele. That's a type of spina bifida, bro.
Yeah, no one likes to show off.
What do you mean? I don't even know if I'm right there.
Yeah, absolutely. This is Wharton's jelly, bro.
Bro, what do you mean, bro? It's Yoki Misoto.
The patient has chronic inflammation in the bowel wall with macrophages and lymphocytes plus attempts at healing that lead to strictures.
Wait, what do we put for 39, 40, and 41? 40 and 41 we skipped, right?
Yeah. And then 39 we skipped as well. 39 and 40 we've skipped.
41 we're on right now, right?
Yeah. Patient has chronic inflammation in the bowel wall with macrophages and lymphocytes plus attempts at healing that lead to strictures. What complication results from the repeated cycles of injury and repair?
D.
Fibrosis and scarring.
D, yeah.
A doctor is counseling an early pregnancy patient about the risk of ectopic implantation. Which site is most common for an
An ectopic pregnancy. Peritoneal surface.
Yeah, of the ovary.
Ovary.
Yeah.
Wait, what the fuck is a tracheoesophageal fistula, bro?
Bro, that's high yield. What do you mean?
Yeah, bro. My bad for being so retarded.
The ampulla.
That doesn't make sense.
Ectopic. Nah, bro, that's where it happens.
Oh wait, no. Implantation, not fertilization.
Ah.
Fertilization is the ampulla.
Wait,
That's
what?
That's a good
No, no.
question.
Okay, what? Can you explain that to me?
So the ampulla is the site of fertilization. The site of implantation is the top 1/3 of the uterus in the endometrium. So if it implants in the ampulla, you get an ectopic pregnancy.
That's good. Good job.
If it implants in the ampulla, it's an ectopic pregnancy. Okay.
Yeah.
This one's easy, bro.
Yeah, bro, B, bro, for sure.
Honestly, I think that's the only one that I know.
Bro, why is there so much embryology in this?
Because this is week 7, I think it is, or week 6, whatever one it is.
That's the one thing I didn't study. I don't plan on studying for either.
That's alright. You'll smash it anyway. You completely dodged it in SAQ.
Yeah.
A researcher sees a strong association between maternal rubella and congenital cataracts. Which criterion especially supports a
B.
causal implication? Yes.
Yeah.
A week 6-week post-op wound reopens after the patient strains. Histology shows minimal collagen cross-linking. Which vitamin deficiency is classically associated? Vitamin C.
See, it's gotta be.
Yep. A 24-year-old presents with anterior abdominal wall defect caused by amnion.
Actually, the umbilical cord, probably, I'm not gonna check. Failure. Isn't it A?
Yeah, I think it's B, but I haven't studied embryology, so I don't know.
The reason why I'm saying
It's in
A
the
is
anterior
because
abdominal wall.
yeah, anterior abdominal wall.
And it's covered by the
They're
amnion.
Yeah, and it's covered by the amnion, so that should be A.
Yeah. A 38-year-old woman has chronic inflammation around a retained suture with macrophages and some giant cells. Which terms best describe this reaction?
B.
Yeah.
Yeah.
A 52-year-old with chronic venous stasis ulcers develops exuberant, heaped-up scar tissue that is not regressing. So this is a keloid.
Yep.
Okay. A surgeon notes that wounds in the leg of an ischemic limb heal more slowly than facial wounds. Oh, wow. I didn't know that.
A, yeah, agreed.
Yeah.
Population study examines folate supplementation before pregnancy and the rate of neural tube defects. After adjusting for maternal age, smoking, and diabetes, it persists, which have the investigators mainly achieved. Yes. All right. You want to read it out?
Okay, you might want to put the entire thing in Gemini.
No, that's all right. We'll go with this.
No, okay. 1, D, A, E, B, C, A, cooked, D, B, D, C,
Okay,
B.
let's just go. Let's just go Gemini.
What's the source for this stuff?
GPT.
I've been doing the same thing. Wait, let me show you guys something.
I gave it the learning outcomes. Yeah, you can share a screen if you want.
Wait, no, I'm just gonna send an image on Discord. Check the server.
Bro, we literally just did an exam where all of our answers was A, bro.
What do you mean? That didn't happen.
Bro, it fully happened, bro.
What is that? 1000 IQ med school recall questions for hours.
Bro, what the?
Yeah, it gained consciousness there for a sec.
Oh.
All right, Shihab, you gonna read it out?
Okay, D. 1 is D, A, E, B, C, A. 7 is cooked, 8 is D, 9B, 10D, 11C, 12B, 13C, 14A, E, D, B, A, 19A,
Oh,
20,
slow down. 17.
B, 18 is A, 19 is A, 20 is C,
Yep.
C,
Yep.
22 is B, 23 is B,
Yep.
24 was cooked, 25 was cooked,
Yeah.
26 is B,
Yeah.
27 is D.
Yeah.
28 is C. 29 was cooked. 30 was D. 31 was A. 32 is B. 33 was C. 34 was D. 35 was A. 36 was B. 37 was C. 38 was D. 39 was cooked.
38 was C here, it says.
Okay.
It says
get back to that.
it wasn't epithelial failure, epithelialization failure. It was angiogenesis and fibroblast proliferation.
Oh.
Yeah, so it's saying C. Filled with granulation and edema fluid.
Okay.
Fair enough.
39 was cooked. 40 was cooked. 41 was D.
It was Walton's jelly.
Are you serious? Yo, my guy. My guy.
Alright, 41.
42. 41 was D.
Yeah.
B.
Yep.
44 was B.
Yep.
45 was A. 46 is A. 47 is B. 48 was C. 48 is A. 49 is A. 50 is A. Okay, how much did we get wrong?
Apart from the ones I told you. So I think I told you one or two of them.
Shahab,
You only
did
told me
manage to
38.
swallow your laptop?
Then we got one wrong.
Sorry?
Did you manage
oh,
to
easy.
swallow your laptop?
Yeah, I got a new one.
Nice.
Got the M5 MacBook Pro.
Have you downloaded the exam?
Yeah, no, I file transferred everything over from my previous Mac.
All right. I'm saying that because with Exemplify, this happened to me before. If you've got it on one device and you want to transfer it to the other device, you need admin permission for that if you've already downloaded the exam. So if you
I haven't downloaded the exam.
all right, that's good then.
Okay, what week are we on? Eight? Okay, 1. Major duodenopapilla. I'm not even gonna read it. A. Jejunum. 2 is E. I didn't really read it. I just read the plia circularis.
Multiple air fluid levels, central small bowel loops, plicae circularis. Which segment is most likely obstructed? Small bowel loops, so it has to be jejunum.
Yeah. So part of the duodenum. She reminds the team. Yeah, it's major duodenopapilla. Ampulla vater is not on the fourth part. Venous blood from the midgut drains into which vessel? Venous gut, superior mesenteric vein.
Venous blood from the midgut drains first into which midgut? Yeah.
But somewhat the splenic flexure may have compared to lymph node. Midgut region. Between midgut and hindgut. Superior mesenteric.
Yeah.
That's a weird question though.
Between midgut and hindgut.
Celiac trunk? What's your logic for this? Occurs somewhat the splenic flexure. Okay, okay, splenic artery. I see what you're saying. That's also what confused me because it's splenic flexure. The answer should be A. Apparently it
Yeah.
was thing. What was the answer? Inferior mesenteric. What's the logic for inferior mesenteric?
Go back to the
Did we
question.
learn this?
I remember Sanka saying something like this before.
Oh, easy. I never watched lectures, so I don't know. I mean, I watched all of them. Oh, okay, no, that makes sense because it's a splenic flexure. Should be inferior mesenteric artery. Oh my fuck, bro. Nah, that's so, bro.
That's smart. I like
Oh,
that.
as in the colon, right?
Yes, that's a
Yeah.
really good question.
Yeah, because
Damn.
I just saw
it's the
spleen and
flexure
then
of
my
the
brain
transverse
stopped.
colon. Yeah. That's
Yeah,
super
which I-
smart. That's
That's
actually
such a
super
smart
high yield.
question, bro.
Yeah. I really like that.
Bro, we need to read the question.
No, we wouldn't have gotten there anyway.
Nah, bro, but like it's so easy.
Okay, but you're cracked. Like, what do you
No,
want
no,
me
no.
to say?
Look,
I'm
bro,
a
it's
bozo compared to you.
splenic flexure.
Yeah,
colon,
if you read,
right?
I agree with them.
It's got to be the inferior mesenteric. It can't be anything else. I just saw spleen and I went monkey brain and I thought superior mesenteric artery.
That's all right. All right, let's go going.
Wait, isn't spleen supplied by the celiac trunk though? Because the
Yeah.
splenic arteries are branch.
Yeah, but the splenic flexure is the flexure of the colon, the large colon.
No, I agree with that.
Yeah.
I clocked that in. It's just I just wanted to confirm spleen was celiac.
I genuinely think this could be in the exam.
I agree. That's super high yield.
Where's the primary renal processes for determining its excretion rate?
A.
Yeah.
Which change is most likely advanced in renal failure?
Like the advanced,
Oh, wait,
decreased
hang on.
renal excretion accumulation,
No, you don't
Uh,
have decreased accumulation. You have increased accumulation.
complete biliary replacement, increased first pass effect, unchanged half-life. Would it be B? Unchanged half-life?
Yeah,
Because you're not
yeah,
clearing the drug, right?
Yeah.
Wouldn't the half-life
Good.
increase then? If you're not clearing the drug?
No, but the half-life refers to how long it's like pharmacologically active before it breaks down. So, like the drug being metabolized has nothing to do with it being excreted.
Fair.
I will check that.
Yeah, check that.
That's such a good question, though. I can't get over that.
Yeah, this one's a really good question.
How? It's not decreased accumulation.
Decreased renal excretion. Look, because the accumulation,
Oh, okay. It's the way it's worded. I see.
Yeah. It's just bad wording. Because the accumulation isn't decreased. It's like the accumulation's increased. It's the renal excretion that's decreased.
Yeah,
Just
but
bad
it's
Yeah.
if like it should say an increased accumulation. I literally pointed that out.
It should.
Also, Gemini is actually pretty good.
Yeah, in
Nice
my
one.
opinion, it's better.
I might
Then,
swap
It's
it
the
out.
same price as well.
Okay.
No, if you go down, actually, scroll down on the Gemini page. They should say something about student.
Ooh,
I might
Yeah.
get it.
for 1 year.
No, I'm switching. I'm getting that. Like, I have to switch over because I already paid for it, but I'm gonna switch over to the student plan.
Yeah,
Mm.
I'm probably gonna do that actually. All right. Anyway, yeah. So it was C, but the wording was dumb.
Agreed.
All right. A highly protein-bound drug has an apparent volume of distribution, low VD.
Drug is largely confined to the plasma.
Yep. I agree. I just want to check because I always get this mixed up.
It should be that.
Yep. Cool. A drug obeys first order elimination, 80 milligrams, and it's 2 hours. What would
20?
be after
E?
4 hours? Yep, just halves and halves again. A narrow therapeutic index is started as a continuous infusion after 4 to 5 half-lives. It's in steady state. Yep, D.
So,
D.
What do you want from me? A patient has right upper quadrant pain radiating to the scapula and positive Murphy signs. This is the gallbladder. And this is the...
Caught it low.
Yep.
Yeah, no, I agree. Caught it low.
Yep.
B.
Medical students asked why drugs with very long half-lives take days to reach therapeutic levels with regular dosing. Which concept explains this?
D.
I feel like it's D.
Yeah, I think it's D.
Yeah, because remember, it's 4 to 5 half-lives to reach steady state.
Hmm.
So it's
Yeah.
going to take that long time. A small bowel follow-through demonstrates mucosal folds that completely traverse the lumen and are closely packed, indicating proximal small intestine. Which part is this?
Proximal small intestine.
Terminal ileum.
Jejunum.
Proximal. That'd be distal.
Oh,
Yeah, I thought it was jejunum.
sorry. Whoa, that was a huge. Yeah, I messed up there. Sorry.
Jejunum is C.
Yep, B. Sorry, C. Sorry, my bad. Yeah, I just completely messed it up. Sorry.
Are you sure, guys? Jejunum.
Huh?
Would that be distal?
Isn't it duodenum,
Oh,
jejunum,
yeah,
ileum?
Yeah.
Ileum, yeah. No, I
Ileum
completely.
is-
Sorry, I messed you up there. I made you even question that. A 9-year-old has abdo pain and watery diarrhea. The public health team asks about recent travel, all that stuff. Which factor is most directly relevant to fecal oral transmission of
I
ABO?
think the answer is E, definitely not A. 9-year-old
Yeah,
still breastfeeding, bro.
I agree. All right, indigenous. You see cultural. You click.
Yeah.
A patient with acute abdo pain is being assessed. Which question best targets localization? Yep, A.
Yeah, agreed.
Do you have ankle swelling? Absolutely. A 7-year-old returns from overseas with foul-smelling diarrhea, bloating, and steatemia. Yeah, giardia.
Steatorrhea.
Like it even says
Trophozoite.
pear-shaped trophozoites.
It's
With
flagella. Flagella trophocyte.
If
Yeah.
you guys see watery rice stools, what are you going to think?
Cholera.
That's the other one
Shigella.
that usually comes up.
Shigella.
Rice stools.
Isn't it cholera?
It's cholera,
Oh.
I think.
What's Shigella then?
Shigella is,
Oh,
I think
that's
it's
pus
dysentery.
and mucus. That's
Yeah.
pus and mucus. Yeah. Yeah, cholera is rice water stools. Yeah. Anyway, 68-year-old man to receive a drug eliminated unchanged in urine and showing first order kinetics, which is the most appropriate adjustment principle.
Just increase
Uh,
oxygen.
E.
Is that the options?
E, yeah.
Yeah.
35-year-old woman started on a drug eliminated by zero order kinetics at therapeutic doses. What is a key clinical implication of zero order?
So just one.
Shorter half.
It's not half-life. It's half-life independent, no? A shorter half-lives at higher doses.
It's concentration independent.
It's not A.
No.
It's not D.
Oh, then B.
C. It's C. It's C. It's C.
C?
Think about alcohol.
Oh, you're right.
Once you go
Yeah,
past
you're right, you're right.
threshold, you're going to completely increase plasma concentration.
And that's a good question because it has to do with enzyme saturation. Okay, I see.
I'll check it.
No, I'm like 100% sure. 99% sure you're right.
I still love that splenic flexure question. That roasted me. It's C. All right. 50-year-old with cholangitis undergoes ultrasound, dilated common bile duct, and a thick-walled gallbladder. Which imaging principle is essential before interpretation of an abdo film or ultrasound? So this is CCS. Yes.
The longest option is always the answer. Good GPT.
Yeah, typically. And an outbreak of giardia, which... okay. What is this? B.
B, yeah, agreed.
A student reading an abdo X-ray identifies haustral markings that do not traverse the full diameter. This is obviously the
Correct.
colon. The colon.
Full diameter. Colon, right? Colon? Okay.
Yeah, colon.
Easy, yeah. 'Cause
Which statement about the
rectum laxer.
SMA?
Is it B?
Yes, B.
Okay, easy.
Which statement about the SMA is correct? The
A.
Yeah.
A physician suspects biliary colic on a history of abdo pain. Which feature supports that? A. Yeah. A patient with chronic hepatic renal impairment is prescribed an aminoglycoside with a low therapeutic index. What is the most important pharmacokinetic principle?
B.
Yep. A 4-year-old in a low-resource country drinks contaminated surface water and gets Shigella. Boil water. What?
B.
Yeah. A clinician wishes to provide culturally safe care to Aboriginal and Torres Strait Islander peoples.
A.
In
I read the word
Japan-
Aboriginal. No.
Excellent. A drug is filtered freely and partially resorbed passively in the tubal. Which change would most change its renal clearance?
Increased protein binding, maybe. It's filtered freely and partially reserved passively in the tubule. Which change would most
It'd be
increase its
A.
renal or increase? Yeah, A. Or let's say decrease.
Yep. Confused about half-life. Which statement is correct for first order elimination?
Constant.
Yeah, A.
A. Yeah.
For first order.
Yeah.
Independent
First
of-
order.
Oh yeah, my bad.
Half-life.
Yep. Well, this is all true. Like
Wait,
wait. Oh yeah, my bad. Yeah.
wait, let me look at 29 again. I'm tripping. First order.
No, first order, isn't it? Half-life is independent, and then second order half-life is dependent on the original dose.
Yeah,
Yeah,
the
yeah.
half-life is always independent of the dose.
No,
Yeah.
for first order, it depends on the concentration present, whereas for zero order, it doesn't matter.
No. The amount excreted
That's-
is dependent on the concentration. The half-life itself, the physical time, is always constant.
Fair. Can we check this one?
Of
Because
course.
yeah,
Yeah, because that's how you do the half-life. It's always like half of it, no matter the concentration.
okay, fair. Yeah. The wording is insane with these questions, bro.
Yeah, it's GPT.
Bro. This is probably what they're going to use to generate the exam anyways.
Do the past exams,
the-
by the way.
Yeah, already done that.
Yeah, for standard E.
Which part of the small intestine does the pancreatic duct usually open in?
Second part of duodenum, yeah, 8.
Approximately how long will it take to achieve 94% of steady state?
12 hours, 60 hours, 5 half-lives, yeah. Bro, they give you the answer, but just...
Roughly what adjusted maintenance dose could be used?
What the fuck?
Standard dose of renally excreted fluid is 200 milligrams, 12 hours. So
Explain how you got that.
Well, okay.
I'm
If
done
they
with-
have trouble excreting, then you want to, like, we see it's 100 mils per minute for a normal person, and they're 30 mils per minute. So you want to
Yeah.
reduce either the dosage or increase the time. So this is the only one that does that.
So the standard dose of reading is 20. You want to reduce the dosage and increase the time because the creatinine clearance is 30 ml. Okay, fair enough.
See? Cool.
Yeah, adjust the dose over standard dose. Yeah, B. 34 is B.
Mhm.
35. Yeah, A.
A. Primary.
Yeah.
One competes for the same active secretory transport in the proximal tubal. Secretory
A.
renal clearance falls and plasma level rises. Yep. Oh, 38. We can't just do it. There's two options with culture in it.
No. Cultural brokerage can improve access and outcomes. Easy.
Okay.
You see culture and unrelated, that's an instant no.
Yeah, A. C?
Mm-hmm.
Re-entering the gut via bile and being reabsorbed, prolonged the what is it going to go? Antibiotics that alter gut flow can reduce absorption. Yeah, C. Agreed. Number 2, a student examining a patient with right upper quadrant must take a GI system exam. History. A.
Like we didn't do our entire Oskies earlier.
Yeah. A 12-year-old presents with fever and bloody diarrhea after family picnic. Multiple family members are ill. This is an example of, I would say A.
Mm-hmm.
Yeah.
44, a manager at a rural clinic wants to reduce medication errors in prescribing anti-helminthics to children. Which strategy aligns with 3K safety principles? Bro, I just read A. I think it's A. It's longest. And then culturally and linguistically use A. Wait, 46? We're on 46, right? A 27-year-old has an infected hepatic hydatid cyst after dog sheep exposure.
This
Wait,
is
what do
A,
you mean?
It sounds like the other question.
Wait, but what do you mean by dog sheep exposure overseas? Like, what do you
They went
mean?
to India.
No, but like, how do you get dog sheep exposure? Like, how did you get exposed? Like, is it contact exposure? Parentally transmitted exposure? Like,
What do you mean parental transmitted?
like bodily fluid transmission? Like, what's he doing to the dog and sheep? You know?
What are you trying to insinuate? Maybe he's
Bro.
just a shepherd and he has a sheepdog.
Maybe he's needle sharing with the dog and the sheep. Who knows?
What?
All right, let's go to the next one.
Alright.
Yeah, A.
Hmm.
I can't get over this dog sheep exposure. What do you mean? Bro?
Guarantee that question will be in the exam.
A for 48, 49, and ultrasound. These are visual. As the patient with epigastric pain, student documents clearly. Yeah, A.
Yeah, and A for the last one too.
Yeah. Researcher builds a logistic regression model for an interior brick outside, blah, blah, blah. What is the main reason? Yeah, control confounding factors, A.
What do you think of that exam?
It was good. There's just too many A's again. Like the last 8 were A.
Hmm. I don't know why chat does this. Like, I did one as well, and everything was just B.
Yeah. Chat be gooning, bro. Oh. Yes, look at the answers in Gemini, no?
Yeah. Week 9. Yeah. We'll go back. Oh, wait, what happened? No.
Also, I gotta move my stuff inside because it's dark outside and I don't want to be sitting outside right now. So I'll wait until we do this.
Oh, you're scared.
No, it's getting a bit uncomfortable sitting outside, and also, what do you call it? I need to go piss again. I've been drinking a lot of water.
Alright. You want to read it out?
Shab, which nerves are you going to use in order to do micturition?
Alright, read it out, Shahab.
Pudendal nerve firstly, because I'm gonna have to piss it out in pelvic flank. Okay, easy. S2, S4. A, 1A, 2E, 3C, 4B, D, A, C, E, D, B, D, C,
Whoa.
A.
11 was C. The visceral.
Yeah, when
Interesting.
we did this one, I was eyeing this one. I wasn't sure.
So the
Oh,
gallbladder is closest to the visceral surface of the right lobe.
oh,
What did-
because it's by the quadrate lobe, not the caudate lobe. Okay, I see what you're saying.
Okay, fair enough.
Did you
Next.
guys say B for that one?
No, I put
Yeah.
I put caudate.
Caudate.
Damn. That's such a
That's all right. We'll keep going.
12D,
Yep.
C,
Yep.
A, E, A, A, E, C, C, B, B, A, E, B, A, E, A, D, C,
C. C.
B, 33 is C?
Yeah, it
Three.
says 4 half-lives. I think this is just because it says achieves approximately 94%. So it's one off the steady state. So 4 half-lives.
Fair.
That's all right. I think we just
30
autopiloted that one.
Yeah, easy. 33C,
Yep.
34B,
Yep.
35 to 38 is all A.
Yep.
39 is A as well. 40C, 41, 40C, 41C.
Yep.
42 to 50 is all A.
Yep. We got it all except for the visceral surface of the right lobe. That's a good question, actually.
Yeah. And the half-life one.
Yep. Yeah, I think we just autopiloted saw half-life. I think that was my bad.
Alright, give me 5 minutes, less than 5. No, actually 5, because I gotta go piss. Inside, because I don't want to see outside video. Hmm.
What do you think of the questions? Yay or nay?
They're great questions.
They're pretty good. Like they're about what I've been getting as well when I tried GPT.
Cool. I'm gonna charge my laptop.
Mm. All right, I'll be off for now.
All right. See you
Might come
later.
back later. How long are you guys on for?
Probably midnight.
Okay,
Yeah,
I might come back then. We'll see. Good
Easy.
luck.
I'll be on after as well, because I'm gonna stay on to do Nick's thing as well.
Oh, before I go, have you guys sorted out accommodation for the wedding?
No?
Because I think we should do that soon. There's like 2 weeks left.
Bro, there's a lot of things to sort out. I don't know if you heard on stream, but I got invited to a wedding in New Zealand, so now I gotta sort
yeah.
that out as well.
Okay.
So there's a lot of things I need to get sorted out this week. Or
Oh,
on the
me, that's great.
17th, bro.
Yeah.
I need to sort out a lot of stuff, man. Like, genuinely, like, the admin tasks have been piling up.
Mm. Me and Umair actually have the same flight, coincidentally, going to Melbourne.
Oh, damn.
Yeah.
Am I hearing Mile High Club?
Two Pakistanis in a plane. What could go wrong?
Oh, man. There's 100 things I can think of that can go wrong. Apparently, everything will burn except your passports.
All right. On that note, I'll head off. See you guys.
Take care, boss. Fuck. Let me mute myself.
You there?
Yep. All right, guys. Alessandro, don't know where he went. Just set up my screen. Guys, I have not eaten anything since like I think 3:30. And that's the only thing I've eaten today.
Hello again.
I've been on this like study fast, bro. I don't know. I'll eat again after we're done. I'm probably gonna eat something thick. Like I'll eat something that's a lot. So that
Wow.
way,
After the exam?
calories. Bro, I'm not hitting my calories today. That's for sure. No, I need this bit bigger. Okay, no, I can't put this screen here. I need to put this
Hear me?
screen on this.
Yo.
Screen. Easy. Okay. No, I can't hear you right now. Let me just. I think it might be me.
What about now?
Give me 1 sec. It's because my earphones are disconnected. That should work now. Can you hear me?
Yeah, can you hear me?
Yeah, no, I can hear you now. My bad. It's because my things were disconnected.
All right, let's continue with this. All right, question 1.
Week 9, right?
Huh?
You give me 1 sec. I'm just fixing the screen. So, okay. H3 week 9 question 1. Damn, week 9 already. Okay, 23-year-old man is undergoing. Oh, bro, I haven't even read it yet. Yeah, okay, agreed. It is C. To a 15-year-old girl attends alone. She appears withdrawn, says she sometimes drinks and is sexually active. Before taking more detail, explain confidentiality. Yeah, A. 3. Which peritoneal statement is most accurate regarding intraperitoneal organs? They are suspended by a fold of peritoneum that are mobile. They lack a mesentery. They have no arterioles above from the aorta. They drain directly to the thoracic duct. Okay, this is. Is it? I'm thinking C, but I don't think so. I don't think they develop entirely retroperitoneal.
I thought it was
think
A.
A?
Yeah,
Fair enough. I don't know the answer to that one. I'm saying A as well.
because the first part of the duodenum is not a retroperitoneal, it's intraperitoneal because it's enveloped
Yeah.
by the lesser omentum of the stomach.
Easy.
C, fair enough.
Oh, C? Easy. Word question. I don't know.
Yeah. So they have so peritoneal fold counts as mesentery. Okay. Fair enough. Organs that lose their mesentery become retroperitoneal. Okay, fair enough. Interesting. 32-year-old woman has a groin mass that lies inferolateral to the pubic tubercle and passes through the femoral canal. Why is this more common in women? B.
B, yeah, agreed.
16-year-old presents with marked weight loss, intense fear of gaining weight, and BMI. You see she's still too fat. Yeah.
Yeah, anorexia nervosa.
A defect in the posterolateral diaphragm allows abdominal viscera to herniate into the thorax. This is the esophageal hiatus. Yeah.
Posterior lateral abdominal viscera. Yeah, agreed. Esophageal hiatus.
Yeah. Yeah, because it happens through the esophagus, no?
A defect in posterior because abdominal viscera to herniate into the thorax.
Or is
I
it
don't
D?
know. I'm thinking
D.
between D and A. I think D makes more sense.
I think it's D. But what should be A? Because that's how these things ends up. Yeah, I guess D.
Okay, easy.
I want to see what it says about A though.
Good.
So it is an opening in the diaphragm, but it's not the it's not the posterior lateral.
Yeah, that's what I'm thinking.
This
Which one was that? 6? 6 is D.
Yep.
7. You're seeing a 14-year-old which heads, right?
Yep.
20-year-old woman who wants to eat healthier. He explained that essential fatty acids must be obtained from the diet because humans cannot introduce double bonds beyond carbon 9. I think it's that one.
Yeah, I don't know what that means though.
Me neither. I just that's the only one that makes sense since because nothing else makes sense.
Mm.
In fasting, blood glucose is maintained by several processes. After hepatic glycogen is depleted, which pathway becomes most important for maintaining blood glucose? Gluconeogenesis, no?
Hmm.
A 15-year-old girl says, I told you this is in confidence. Are you going to tell my parents? What is the most... Oh, yeah, C. C makes the most sense. You're right. Oh, 9 was C?
Yep.
10
Nine
was C as well.
Oh, yeah.
Okay. The glistening serous membrane lining the abdominal cavity and reflected onto abdominal organs. This is the serous membrane. It's not transverse. The parietal-peritoneum.
Lining the abdominal cavity and reflected onto the organs.
I'm just thinking of that blue link card that goes like parietal-peritoneum, extraperitoneal fat.
Yeah. I don't know. I think I'll guess C.
Watch it on PC.
Yep, it's C.
Easy. Let's get that clutch.
Yeah, because it says like a serous membrane. Like it straight up says membrane. So like it can't be, it could be, like the fascia is too far out. It doesn't go onto the organs.
Yeah.
I know that we have an endothoracic fascia. I've never heard of an endo-abdominal fascia.
Me neither.
And the
And isn't
rectus
it transversalis fascia? It's below the arcuate line as well, no?
yes.
Okay, I thought I was retarded.
Okay.
17-year-old
boy. Yeah, same question.
Yeah. Her BMI is normal. Dental enamel is eroded. What is the most likely
No, we skipped
diagnosis?
13.
Oh,
13.
sorry, my bad. A nutrition consultant discuss basal metabolic rate. Which factor most strongly increases basal metabolic rate? Whoa. Increases. Increased lean body mass? Sleeping? Oh, makes sense.
I thought it was sleeping.
It's sleeping. It's sleeping. I agree. It's sleeping.
What?
Okay, fair enough. Maybe I was right. 13C.
Oh, it's lowest when it's sleeping. It couldn't be more off.
Sleep.
Alright.
14. Is it 13? Is that 13?
Yeah, I'm not doing well in these. Wow. 19-year-old girl, a 19-year-old presents with episodic binge eating followed by self-induced vomiting. This is bulimia nervosa.
Agreed. Bulimia nervosa. Bulimia?
Okay,
Is it bulimia or binge eating? Bulimia.
it's the
Episodic
vomiting.
binge eating.
It's self-induced vomiting with erosion of dental enamel.
Okay.
16-year-old refuses to allow his parents in the room. He appears mature, understands the discussion and consequences of its testing for an STI. This is best handled by C.
See. How old is he? 16?
Yep.
Mature mind and maintain. Yeah, no, 16. That should be fine. So, now we move on to question 16. 55-year-old man develops an incisional hernia through the linea alba above the umbilicus. This defect occurs in which abdominal layer? External oblique.
Mm-hmm.
Wait. Anterior apneurotic abdominal wall, linea alba.
It's through the linea alba. So the
Oh,
linea
okay,
alba
easy.
is not concentrated.
16A. Okay, easy. When interviewing adolescents, which opening strategy helps establish rapport? Yeah, easy. C. 18. Starvation ketone bodies. They're not gonna ask that. They already asked that. Strict vegan.
Yeah.
Which micronutrient most micronutrient isn't it B12? I would assume.
Yep, B12.
John, is that C?
Yep.
22-year-old woman. Oh yeah, okay. 14-year-old boy is brought by his mother who wants to stay for the whole video. He says he wants to talk about sexual orientation, but not in front of her. What is the best approach? And C?
Yep.
21. A medical student is asked to identify the deep inguinal ring is an opening in which structure? Isn't it external oblique transversalis fascia?
That's superficial ring.
Hmm.
This is deep
Yeah.
ring.
Deep would be. I don't think it's internal oblique. Transversalis fascia.
Yeah. Let me check.
Yeah, no, I think you're right though. I think it's transversalis fascia. I don't think it's external oblique.
Yep.
Easy, makes sense. 15-year-old girl presents with irregular menses, low weight, intense exercise, and restrictive intake. Do you suspect disordered eating? Which question best explores body image concern? C. 22C?
Mm-hmm.
23 is in the fed state, which pathway is the most active in the liver? Glycogenesis.
Mm-hmm.
24, a 50-year-old woman presents with a reducible swelling above and medial to the pubic tubercle, protruding through the Hasselback triangle. Not passing, that's direct.
Mm-hmm.
25, 17-year-old boy has a BMI of 30. Not gonna say anything about ancestral adiposity. Which of the following is the most accurate? It is a chronic. Yeah, agreed. 26. 25-year-old male has swelling below the inguinal ligament that passes through the femoral canal and lies lateral to the pubic. Passes through the femoral canal. Femoral hernia.
Mm. Yeah.
13-year-old girl says she sometimes. I can't say that on stream. Herself. She has no current plan to. No psychosis and a safe home. You will keep information provided. Ask. Oh, yes, C. Agreed. 28. Which hormone is primarily secreted by leptin?
Yeah, I got it mixed up for a second. Because
During
ghrelin
prolonged.
is the accurate nucleus of the hypothalamus
Yeah, agreed.
and gastric mucosa.
During prolonged fasting, which tissue continues to require glucose because it cannot use fatty acids directly? Red blood cells? I don't know. I think it's red blood cells. B?
I don't know.
I'm going with B, bro. I just don't know how the red blood cells can use that. Because they don't
I'm
have
gonna
a new.
I'm gonna go with cardiac. Yeah, because red blood cells don't have a nucleus.
Yeah.
I'm gonna go with C.
Okay, check that.
It's obviously not the liver.
Yeah.
Oh my
Oh, red blood
goodness.
cells easy.
How do you just logic it? I don't get it.
Oh, because I know red blood cells, they still produce ATP because they use that as treatment for something, or they use it to check something. I forgot what it was. And I know cardiac muscles and skeletal muscles, they need to use fatty acids and ketone bodies in order to function long term. So, because for me, if you give two muscle options, that means both of them are wrong. Adipose tissue is obvious, liver is obvious. So, and then red blood cells is because they lack a nucleus, they can't produce other enzymes either. So it's limited to that cell cycle. It's like the same thing with platelets and the limitation of its cell cycle affecting something else. I forgot what it was.
Okay, fair enough.
But-
So you do have some background knowledge.
Yeah.
Fair enough.
16-year-old with binge purge behavior is concerned about privacy. She is not underweight, has normal vitals, and no suicidality. What is the most appropriate next step? Yeah, C. 31. During abdominal examination, you note a bulge that becomes more prominent on coughing, and it's like, okay, it's indirect. No, isn't it? No, sorry, let me read all of it.
The midline.
Yeah, midline. I didn't read all of it. My bad. Incisional hernia through previous scar. The answer is
Yeah.
A. I know it's direct that instigates coughing. A 14-year-old who is otherwise healthy presents with low mood after school bullying. Yeah, heads assessment. I just read heads assessment. That has to be right. Which one is heads assessment? B?
Yep.
33. The
Mhm.
patient is in the post-operative period overnight. Which hepatic process is the first major source of glycogenolysis?
Mhm.
34. A 27-year-old with a manually reducible groin swelling is found to have a hernia sac entering the deep ring lateral to the inferior epigastric vessels. Inguinal, indirect inguinal.
Mhm.
Direct is medial, right?
Yep.
Okay. 17-year-old with anorexia nervosa presents with bradycardia and electrolyte imbalances. Which is the most urgent principle of management? Medical stabilization and careful nutritional diet. A 16-year-old boy eats more kilojoules than he spends. See. The superficial inguinal ring is an opening. Okay, external oblique aponeurosis. Yeah, 37 to see. 14-year-old boy tells you privately he sometimes drinks heavily at parties. What is the best response with it? Bro, we've had the same question like 6 times.
Yeah, but remember, it's 50 questions for this week.
2. A very low carbohydrate diet will make which pathway more active to maintain blood glucose? Very low carbohydrate, gluconeogenesis, yep. A 15-year-old boy with abdominal pain is being examined. Which special concern? Explain what you're doing, ensure privacy, not for chaperone. Agree C? B.
Mhm.
41. A 34-year-old woman has an inguinal hernia and is therefore important in its weakness, external oblique aponeurosis.
Which structure forms the posterior wall of the triangle? What do you mean
Oh,
by
sorry.
posterior?
Posterior wall of the triangle. Uh,
I don't understand what the posterior wall is.
I'm going with transverse. I'm thinking
With the
posterior.
fascia.
Yeah, transversalis fascia makes sense.
Yeah.
See?
Yep.
A 16-year-old wishes to discuss contraception. She demonstrates, proceeds with yes. See? 43. During
Mhm.
prolonged fasting, adipose tissue immobilized. Which hormones respond? Yeah. See? 14-year-old adolescent is susceptible. Bulimia needs dietetic and mental health follow-up. 17-year-old presents with an erythromatous parotid swelling and is refused to speak in front of a step-party. Using interpreter person language. Yeah, B.
Mhm.
A 30-year-old man has a small umbilical hernia where peritoneal second fat protrude through a weakness at the umbilical ring. The hernia is best described as paraumbilical, no?
Yeah. It's at the umbilical ring.
Older adults present with low weight and anemia. During early fasting, which subjects mainly use for gluconeogenesis, lactic glycerol? Yes, see. Medical student presenting an abdominal CT identifies rectus abdominis, transverse abdominal peritoneal inflection. This is which patients have clear communication to avoid diagnostic and hardcover errors. See. Okay. Researcher compares adolescents with restrictive eating disorders and adjusting to identify the independent effect. Why adjust? Yeah, see, okay.
Yeah. You wanna read it out?
Yep.
Yeah.
One.
Give me a sec. Give me a sec. Give me a sec. All right, start reading.
1C.
Oh, this is
2A.
taking long. Hang on, this is taking a long time. We should just probably move on because this is gonna take forever. Yeah, this is taking a crazy long time. All right, set up the next one. Save this one, obviously.
Oh, are you at your limit for Gemini?
Maybe.
Hmm.
I'll refresh. We'll see. Here we go. Read it out.
Okay, ready, set, C.
Yep.
A.
It says B. Wider femoral canal.
I might have accidentally put thing.
No, I got the questions mixed up. Yeah, this isn't the right order. Oh, come on, don't do this to me. Read it out.
C.
Yep.
A.
Yeah, I got the order mixed up again. Oh, this is so annoying. I don't understand. Epigastric
Try
hernia.
Claude.
Yeah. It was doing so well until it wasn't.
Oh, maybe try a different one.
Yeah.
Nah, fuck. Try Claude, bro. Yeah, I'll remove your screen until you load that.
That's right, thanks. Yeah, read it out. Now Google fixed itself up. All right, read it out.
Okay, C. A.
Yep.
C.
Yep.
B.
Yep.
D.
Yep.
D.
Mhm.
B. C. 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 B. C. 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 A. C. C.
Question
C.
16.
A. 16 is A.
16 is D, it says. It was the linear alba. Because it says through the linear alba. Yep. That was my fault. I led you astray there.
Oh, good, bro.
All right, keep going.
17C, 18C, 19C, 20C, 21C.
Yep. All the
They're
way
all
to
C until 20. So 24 we put D.
Yeah, that's right.
Oh, 25C, 26D, 27C, 28C, 29B,
Mhm.
30C, 31A, 32B, 33C, 34B, 35D, 36C, C, C, C to 39, 40 is B. 41, 42, 43 or C. 44, 45 or B. 46 is D. Then 47 to 50 is C.
We got 31 wrong.
31. What was 31? 31 we put A.
Yeah. So the answer to 31 is C. To the linear alba. And again, I just think that we didn't read that question right.
Fair.
Doesn't say that they had a scar as well. Anyway. All right, let's do the next one. Week 10.
What was the answer for 31? It was C?
Yep.
Ten we go. We're on good pace right now because we're going to be on for 4 more hours.
3.
Not 3 more hours, my bad.
All right. Let's do it.
All right,
Question
42-year-old woman. Yeah, 42-year-old woman presents as right upper quadrant pain. Ultrasound shows a pear-shaped sac on the undersurface of the liver and the gallbladder fossa, connected to the extrahepatic biliary tree by a single duct. The structure is derived as an outgrowth from the foreground stores bile. What is it? Okay, that's pretty easy. That's gallbladder. CT, identify the falciform ligament anterior and the IVC posterior, the functional division of the liver into the right and left. Cantley's line.
Mm.
Neonate develops jaundice with raised unconjugated bilirubin but normal liver enzymes. In normal adults, unconjugated arriving at the liver is first uptaken, yet conjugated by glucuronide acids. C. 4. Gallstone lodge at the hepatopancreatic ampulla would block bile flow from the liver and secretion of the. On imaging, the stone would have been distal to the junction of which two ducts? Common bile duct and main pancreatic. Hepatopancreatic ampulla should be D.
Yeah.
Patient with jaundice has dark
Yeah.
urine, pale. Sorry?
No, yeah, it's D. Yeah. Sorry.
Easy. And raised conjugated bilirubin. Which of the following best explains the pale stools? Reduced secretion of bilirubin in bile. Yes, D.
Yep.
Which blood glucose rises when blood glucose rises after a meal? The liver helps restore normal levels mainly by glycogenolysis. Rises after a meal. Okay, no, sorry, glycogenesis. Sorry, after. Read that wrong.
All good.
7. Medical student is tracing the bile duct to join the common hepatic duct to join the. So which should yes, cystic duct. Okay. A patient has elevated AST, ALT, and raised unconjugated biliary sugar at the cellular level. Bilirubin may be water-soluble for extrusion. Which enzyme in the smooth endoplasmic reticulum does this? C. UDP glucuronidtransferase.
Mm-hmm.
30-year-old man develops jaundice 6 weeks after returning from overseas. Serology shows an acute Hep A infection, fecal oral ingestion, and contaminated food. It's C. 55-year-old man with chronic Hep B has persistently raised ALT and positive HBS antigen for years. He now presents with worsening jaundice, which investigators best distinguishes a conjugated from unconjugated form of hyperbilirubinemia. Yeah, fractioned bilirubin makes the most sense to me. During laparoscopic cholecystectomy, the surgeon identifies a triangle formed by the cystic duct, callus triangle. 12. Patient with jaundice has markedly raised alkaline phosphatase and gamma GT. Ultrasound shows dilated intrahepatic ducts. What pattern of jaundice does this biochemistry most strongly suggest? Obstructive, because I think GGT is. It's ALP is found in the bile duct, right?
Yeah.
Or GG, it's ALP. Yeah.
So ALP
B.
is the bone marker as well as in the bile duct.
Yeah, and then it's GGT that specifies it, right?
Yeah. If GGT was normal, then it's a bone condition.
Easy. On histology, which cell lines the sinuses and forms the main pancreatic place forming the central vein? Hepatocytes? What? Hepatocytes, right?
Hmm.
C is hepatocyte. 14. Junior doctor reviews hepatic HSP positive, anti-HBC, acute, highly infectious Hep B. Yeah, because it's HBE positive, it should be highly infectious. See. 15. Woman presented with scleroicters and pruritus, left eye, conjugal eye. This is from what is most likely underlying cause of the jaundice. Genetic absence of UDP intrahepatic cholestasis due to drug injury. I'm thinking it's that.
Because gallstones, so it's not extrahepatic. Oh,
Wait, high conjugate high ALP, okay. Extrahepatic biliary obstruction. Yeah, I think it's E.
yeah.
ALP. I see that. E. 16. 40-year-old woman with metabolic syndrome has mildly raised ALT, AST, GGT, but a normal bilirubin. Which of the following is a key synthetic function of liver that can be measured? Albumin production. Yep. Agreed. 17. Surgeon demonstrates the segmental anatomy of the liver used in hepatic resection. The functional segmentation is space prominent distribution of the portal tri. No, it's not that one. Venous drainage is the IVC.
Hmm.
Patient presents with fever, jaundice, and right upper
No, you
quadrant pain.
missed the question.
Oh, sorry. Man with alcohol-related liver disease has raised unconjugated bilirubin in normal physiology. Unconjugated transport, yeah, bound to albumin. Patient presents with fever, jaundice, and right upper quadrant pain. Ultrasound shows a distended gallbladder and dilated common bile duct. The stone is likely lodged distal. Yeah, I think it's distal, right?
Yep. Well, yeah, because the common bile duct is dilated.
Yeah. A 25-year-old healthcare worker sustains a needle stick injury from a patient with chronic Hep B. Hep B increases the worker's risk of it's non-enveloped and very fragile, has a high blood. Yep. See. 21. Yeah, splenic nerve. I'm not even going to read that. A blood test shows conjugated hyperbilirubinemia in a patient with pruritus and pill-Sues. Which additional laboratory findings is most consistent with obstructive cholestasis? B. Yeah, we had that already. 23. The classical unit of liver range. Yeah, put a power trial. Yeah. 24. A patient has recovered from acute hepatitis A. Which of the following statements is most accurate? C. 25. A 63-year-old with long-standing cholestasis develops intense pruritus and xanthoma. Which biochemical change most directly causes these manifestations? Xanthomas. Intense pruritus and xanthomas increased. It's not that one. Bile salts. I'm thinking plasma bile salts. Yeah, it's bile salts, right?
Hmm. Because they can't get it into their gut, so it goes and leaks through their blood.
Yeah, easy. In the fasting state, the liver releases glucose into the blood. Which pathway provides glucose rapidly in the first glycogenolysis? Okay. 27. A medical student is asked to identify the structures in the portal. Which of the following is normally part of the portal vein, right?
Hmm.
Okay. 28. 34-year-old presents with fever and jaundice, ALT, AST, modest ALP, positive HAV. Which hepatitis brand is this? Acute viral hepatitis and hepatocellular injury. Scleroicters, that shows unconjugated not normal ALP. Bowel drainage to the combat. Which part is most likely impaired? Yep, bowel drainage, that one.
Hmm.
Okay. 51-year-old with chronic hepatitis C has a prolonged prothrombin time, which explains this. Yeah, agreed. B. 31. An ultrasound descending pelvic stone is seen. The cystic artery to this organ is most often a branch of the right hepatic.
Agree.
Yeah, agreed. Patient with the jaundice has dark urine. Which statement best explains the dark conjugated water soluble and excreted in urine? Yeah, it's B. 33. On liver histology, a portal tract is seen containing a bile duct lined by cuboidal epithelium. What other two structures normally accompany this bile duct? Yeah, B. 24-year-old healthcare worker is vaccinated against HPV. Shows anti-HPSA, anti-HBC. What's to indicate immunity due to vaccination is C. "35. Patient with chronic liver disease presents with yellowing of skin, which of the following can also deposit in tissue as a brown. Yeah, lipofuscin. 36. They're gonna ask that question. Man with Marcos is treated. Which vitamin deficiency is particularly at risk due to reduced bowel in the gut? A, D, E, K, vitamin A. 37. Women with right upper quadrant pain and fever. Ultrasound shows a thick walled gallbladder and stones in the neck of the gallbladder. Which duct is immediately distal to this level of obstruction? Bulb cystic, no? Cystic, right?
Yes.
38. 45-year-old woman with acute hepatitis A has raised ALT, AST, and mild conjugated bilirubin rise. Which of the following liver functions is most directly reflected by serum albumin? Detoxification of bilirubin. That's the answer. Oh, synthetic.
Sorry,
Yeah.
Let me read this.
I think it's synthesis capacity, no?
Sorry, my computer's lagging. Yeah, it is. I think I have too many things open.
No worries. 36-year-old has jaundice due to extrahepatic bile duct obstruction, which APTT INR? PT-INR, right?
Yep.
INR B.
Mm-hmm.
Oh wait, I didn't even look at 40 yet.
Oh, sorry.
Pathology report from the liver biopsy describes extensive intrahepatic cholecystasis with bile plugs and calniculi, but no hemolysis, which lab result? Yeah, it's B.
Mhm.
IALP. 41. During surgery, the surgeon retracts the liver and identifies a less momentum containing the portal tract. Free edge of the middle runs between the liver and what is lesser curvature of the stomach, first part of the duodenum. Yep. Patient with acute hepatitis B is constant about infective. E. Let's see. The answer is C. 45-year-old Brazilian jaundice right upper arm, AST moderately raised. You suspect viral hepatitis. Which virus is most strongly associated with progression to chronic infection? It's B. 44. Student looks at a section of duodenum and compares it to a section of liver. Which feature is characteristic of the liver but not the duodenum? C. 45. 50-year-old woman with gallstones has episodic jaundice after fatty meals. The most likely immediate cause? Yep. A 39-year-old man has dark urine pale cystic pruritus, also known as a dilated common bile duct due to a stone. Which of the following jaundice is this? No, it's not hepatocyte. Obstructive, yeah. 47. Medical student receiving bilirubin metabolism. Notice that in the intestine, conjugated bilirubin is converted to, intrahepatic circulation. 48. Patient with hepatic failure and jaundice develops generalized edema. Which mechanism best explain this? C for 48.
Say that again, sorry.
49. 48 is C.
Yeah.
Pretty program regarding cholangitis as precision cholestatic LFTs. The GP documents results clearly and communicates into the pathology. Clear communication and handover. 50 is researcher analyzing jaundice cases, adjust for age, sex, and alcohol use and control for kind. Yeah, see. Okay, I'll read them out to you.
Give me a sec. Did that one pretty quickly.
Yep.
I'm gonna see which one spits it out first.
Easy.
All right. Yep. Give me.
A, 1, B, C, D, D, A, C, C, A, B, C, E, A, C, D, A, B, C, 26A, 27.
Sorry. 17 and 23 we got wrong.
17 is what? What's the answer for 17?
17, it says the answer is B.
And 21?
Yeah, distribution of the portal triad, not the venous drainage to the IVC.
Oh, easy. Makes sense. Okay, 21?
Yeah, and then 21 was not 21, it was another one. 23.
23.
23 was
No, classic hepatic lobule. Did we do 23?
I don't know if we did 23. I don't remember this. This is the portal triad. Oh wait, no, it's classic hepatic lobule, right?
Is that the answer?
Yeah. Keep going. 24.
Wait, what was 23 like? What was the
C.
question? No,
It
what was the question?
was, what is the microscopic unit of the liver called?
Oh, okay, easy. 24 was C.
Yep.
C, A, A, C, A, B, A.
29 was C.
29 was B.
29 was C.
C.
High okay, we misread this. High unconjugated bilirubin. So increase uptake or conjugation. So which is most likely impaired. If you have too much unconjugated bilirubin, it means that you can't conjugate it.
Easy. Okay, 30 was B.
Yep.
A, B, B, C, A, C, B, 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 A, C, B. Then the rest are C.
Yeah, cool. That's it.
Bro, my brain is like it's not working no more, bro.
You gotta keep going. Suck it up. All right. A 54-year-old man with long. Oh yeah, this messed up. It jumped to week 31, even though I asked for week 11. So that means I have to go to the bottom to find the actual questions. Give me a sec.
Okay, let me just quickly go take a piss and grab something from downstairs to eat because I have barely eaten anything today. I'll be quick.
All right.
Alright, I'm back.
All right, let's keep going.
Mm.
All right, week 11.
Uh-huh. Mm. There's totally hooks around the superior mesenteric vessels.
Yep.
A.
Yeah.
Blood supply to the head of pancreas, the principal artery, arcade, B.
Mm-hmm.
Tail body.
Yep.
Why dense core secondary granules and eccentric halo?
I don't know.
What? PP?
Yeah, I was gonna guess PP because secretory. But I don't
Yeah,
know.
that's what I'm thinking as well.
Anyway,
Mm. Well, look, public smoking.
oh, actually, I don't know. Hang on.
Yeah, I think it's vagus
pelvic
nerve. Vagus nerve. Vagus nerve.
Oh, you're saying Vegas. Okay.
Promotes outlet hormone secretion. Clearly, one stop. Yeah, I think so.
Give me a sec. Vegas nerve, yeah. Okay. I didn't know that. All right. Ventral is the alkalinate process.
Yep. Good.
Pancreas divisum, often most common.
It's ventral and dorsal pancreatic duct.
Yeah, that's the only thing it could be. Obstructive jaundice for carcinoma of the head of pancreas is best explained anatomically by compression of the cystic duct.
Mm.
The main pancreatic duct normally drains at the
B.
yeah. Insulin is secreted pre-proinsulin that forms in
R.
the
A.
yep. In the B.
Yep.
Yep. The principal trigger for that is that one.
C.
Yep. This. Yep.
Wait, what? Yeah, I agree. 14C.
Insulin receptor engagement initiates signaling primarily by RC. Easy.
C.
Yep. The insulin, the ratio in the postprandial is yeah.
Genolysis. And
No,
postprandial is post-fullness state, right? So it's C.
Yep. Insulin acutely increases glucose uptake mainly by A. No.
No?
B. Sorry, my bad. B.
Yeah.
B. Yeah. GLUT4 is muscles. GLUT2 is the liver.
Yep.
I just had to reread the first part of the question.
Easy. During fasting, glucagon promotes hepatic glucose output by stimulating hepatic glucose output. Yeah, C is the only one that makes sense.
Yeah, because that's for glycogenolysis.
Gluconeogenesis, no?
My bad. Yeah, gluconeogenesis. Sorry. Yeah. Boop.
Yeah, peribuckinary.
Mhm.
Oh, wait, 18 is what? What was 18?
C.
C.
Yeah.
19.
C.
C as well.
Yep.
20.
We're doing it now.
A.
Yeah.
21.
Glycogen breakdown. C.
Yeah. Wait, why does it say A beside both of them?
I don't know.
C. 22.
D.
Inhibition
D.
of HCl? No, that doesn't make sense. It should be the low insulin. Yeah, okay, I agree. I think it's D.
Yeah. Activation of HSL.
Yeah.
Yeah.
Yep.
Carotene shuttle.
Isn't it C?
Yeah. Because it has to be transported to move in.
24. Certain TCFs provide reducing equivalents mainly as, yeah, agreed, C. 25. Systolic citrate export.
No clue. But
Uh,
I'm gonna assume it's
beta, no.
urea cycle.
Yeah. Exports are leaving it, right?
Yeah.
Hmm.
I don't know. We never
B,
even
maybe?
we've never mentioned citrate. But
Can you
B
check?
makes
I
sense.
think the answer is B.
B does make sense. Yeah, good job. Okay. 26.
C. 25 is B.
Yeah,
26 C.
25 is B. Yeah, 26C. Yeah.
Platelet contribute to hemostasis by providing a surface that. C.
Mhm.
27 C. 28.
Yep.
Endothelium maintains vascular integrity primarily by producing an NO with antithrombotic properties. TXA2, no?
This is when it's injured.
Oh, okay, easy. Yeah, you're
It
right.
just says maintains vascular integrity.
29. C. Yep, agree C for 30. 31. Insulin deficiency should go to unchecked. Yeah,
yeah.
C. 31 C.
Yeah.
Biochemical basis of DKA includes increased delivery of FFA to liver and yeah, C. 33. Polyrisk and uncontrolled temperature effect explained by C. They're gonna ask that for sure.
Yeah.
34. C. Controlled. Oh. 5. Read right now with you. 36. Oh yeah, I agree. I think it's B. 37. B.
Yep.
38. Global hypoxia and infraction.
Yeah.
Is that B?
Yeah. I have no clue what 39 is.
DNA laddering on gel electrophoresis. I have no clue.
We'll skip it.
I think it's C.
Sure. 40 is C.
Yeah, agreed.
41 is B.
Yep.
42 is C. 43 is C.
C 42.
Yeah, and
43.
C for 43.
Oh, yep.
44 is also C. 45
Okay.
is also C.
We have C.
46 is also C.
45 C.
Yeah, 46 and 47 are also C. 47 is also C. .48 is also C. 49 is also C. And
50 C as well.
50 C as well. Excellent. All right.
Yeah. 1A.
1 second. Go away. Oh, did I run out of free tokens? I did.
Damn.
That's all right. Let's try this out. All right, read it.
1A.
Mm-hmm.
2B. 3B.
3C.
4A.
3C. Oh, that's dumb. Look at 3.
Neck relative to body. Tail relative to head, right?
Yeah, it's tail relative to head, but we just said tail and body.
Fair.
Question 4. Just say the letters.
4A. D.
4A.
Yeah.
4 is C. Oh, wait. Oh, I got the order wrong. I don't understand how it gets the order wrong like that. Okay. Answer these questions in the order I them. Okay, let's go again. Go again. So 4 was
4 was A.
4 was C.
Wait, what?
It's actually the beta cells have the secretory granules with the eccentric halo.
Okay, fair. We didn't even know that answer, so like it's whatever. I remember that was the one where like, what the hell is this?
Yeah, 5. Just read the letters.
D.
D.
A. Yeah, 5D.
Yeah.
A. C. B. B. 10 is B. A. B.
9 is C.
B.
9 is C. Didn't we put this?
No, we put cystic dog.
Oh. Fair enough.
That makes sense,
Okay.
though. It should be C.
Yeah, that makes sense.
7C.
10?
10B.
Yeah.
11A.
Yeah.
B. C. 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 B. C. C. A. C. D. C. C. B. Okay. 26. No, jump up. 26 to 35 is all C.
Yep.
36 is B. 37 is B. 38 is B. 39 is C. 40 is C. 41 is
38.
B.
38 is C.
Wait, what? Oh my goodness, that
Oh, apoptosis, not necrosis. Oh man, that's not good. Anyway, keep going. 39.
that's on me. I should have picked that up. 39C, 40C,
Yeah, you guessed
41B,
that right. Yeah.
42 to 50 is C. Which one did I guess right?
You guessed the DNA ladder one. 39.
Clutch guess right there.
All right, let's keep going.
We're on week 11, right? Or,
Week 12.
oh, no way. We're flying
Yeah.
through this.
Maybe. Okay, week 12.
Okay. It's a single amino acid substitution in the beta globin chain alters oxygen. Which level protein structure is this? This is primary sequence.
What?
Oh, a single amino acid substitution in the beta globin chain alters oxygen affinity. Yeah, no, it's quaternary. My bad. I didn't read it right.
Yeah, because it affects one of the chains.
Yep, that's on me.
It could be B though. I don't know.
Quaternary. I think it might be B actually. For Bohemian tertiary, for Bohemian fractions.
I'm gonna change my answer to B.
I think it's B as well.
Yeah, we'll see though, because it's just the only doesn't. I don't get the only, so I think it must be B.
Yep. She's group A O. Her partner is B O. Having group O 50?
25%.
Yeah, I think it's 25 as well.
Yeah, because O is recessive.
Yes, sir. Neonate is bound to predominant fetal hemoglobin alpha 2 gamma 2, which is high affinity for oxygen and adult, which mainly accounts for this high oxygen affinity. It's E.
Yep.
The 4-year-old presents its short marks. Let's see.
Yeah, I agree with that.
Low reticulocyte normal bilirubin. Bone marrow biopsy shows reduced erythroid precursors. Which category best fits this anemia? Decreased production.
Yeah.
Never heard of that type of anemia, but okay.
Yeah, it's
33-year-old
aplastic.
aplastic. I know that, but I never knew they called it like the decreased production.
Yeah.
30-year-old woman with beta thalassemia trait. This is best described as a defect.
I don't know. I thought
Okay.
it was like a stop codon.
Reduces beta globin chain synthesis. This is best described as
Yeah, it messes with the heme biosynthesis.
heme
you have
biosynthesis.
You have small hyperchromic. Yeah.
Yeah, that makes sense. D makes the most sense. 7. Trauma patient with massive hemorrhage is urgently transfused with group A. Positive later, it is revealed that the patient is group O positive. Oh my goodness. It's B, most likely.
Yeah. Gosh.
Whoever did that needs to get fired, bro. 8. Researchers studying the beta globin gene. She identifies a DNA segment upstream of the. It's a promoter.
Yeah.
9. VSS RHD positive. Yep. B. A B.
Yeah.
FBC hemoglobin 70 GL, MCV markedly low and low ferritin. Iron deficiency anemia.
Of course.
Uh,
This
low transferrin.
Yeah.
Novel point mutation introduces a premature survival in exon 2 of the yeah. Truncated non-functional B. 13. A 42-year-old woman is typed as group AB, Rh negative. Which blood can she safely receive? Yeah, B, universal donor. 14. Child inherits 2 defective. Interesting by most mutation behave as recessive. C.
Hmm.
15,
really
30-year-old has elevated HbF on hemoglobin and mild anemia. Which difference between fetal and adult hemoglobin is yeah, C. 16. Upper limb infection. Upper limb actually. B, right?
Mm-hmm.
17, 20-year-old woman with a previous Rh positive pregnancy did not receive it. Anti-G prophylaxis in her second pregnancy with an Rh positive fetus. This is almost like the outcome. Yep. 18. Laboratory demonstrates that iron absorbed from the duodenum is transferred in plasma bound to a specific transferrin. 19. 64-year-old woman has chronic inflammation and develops anemia of chronic disease. Which iron handling change is most typical? Reduce iron availability for erythropoiesis despite adequate stores.
Yeah. Yeah, interferes with IL-6.
Easy. A 6-year-old boy requires a blood transfusion. Cross-matching reveals donor cells are lysed when exposed to recipient serum, which is supposed to select an alternative.
Nah, bro,
Straightforward.
give it to the kid.
Bro, yeah, bro. You give it to him. You give him A positive blood despite him being O negative.
Oh yeah.
21. Which is in DNA repair pathway. Do you have maintained fidelity? 20. 25-year-old woman is found to have microcytic anemia. Her FBC shows low MCV, low ferritin, high transferrin, normal bilirubin. Primary mechanism. Insufficient iron. Yeah, makes sense. Insufficient iron.
Oh, hang on.
Yeah, I'm thinking. Wouldn't transferrin be low?
Yeah, low ferritin, high transferrin. Low ferritin. What? No. Maybe. Maybe. It's B or D?
I'm thinking B or D. I'm thinking B. Because I'm thinking like thalassemia.
Yeah, but this could be sideroblastic anemia.
True. Check this one.
Because I know that thalassemia results in less hepcidin, and less hepcidin can increase iron absorption. So you would have high ferritin and high transferrin, and that's how you have hemochromatosis.
All right, easy D then.
I'm going with D personally, but I don't know.
Put that in Gemini. Let's see what it says.
Easy. Oh.
Wait, what the fuck?
Lovely. Oh my god, it's the thing. High transferrin is total iron binding capacity.
I'm a retard. I'm sorry. I said low transfer. That's on me.
That's okay. Ah, it's the opposite. Okay, fair enough. That's all right. We fumbled there. It's getting late. We've done how many questions today? 500?
Yeah, a bit more than that because it's like 50, right? And we're on week 12.
Yeah, so 600 questions plus whatever we did earlier today.
Yeah.
A 48-year-old woman has an autosomal dominant bleeding disorder on pedigree. The condition appears in every generation, affects males and females equally. It's just autosomal dominant.
Agreed.
The 7-year-old boy from a consanguineous marriage. They're both heterozygous carriers.
Yeah. Sorry. 23 was what? 23 was C.
Yeah.
24 was
See.
C.
A 45-year-old man with chronic transfusion-dependent anemia presents with skin hyperpigmentation. This is hemochromatosis, secondary iron overload. A 22-year-old male has a splenic hilar mass that will require partial splenectomy. Which anatomical relationship of the spleen is most likely to avoid pancreatic injury? It's close proximity to the tail. Yeah,
Is
Oh, I
most
think-
relevant to avoid.
I think it could be. I think it could be C.
It's not, bro. Sequel? Bro,
Facts,
what are you
bro.
saying, bro?
Facts,
What?
bro.
Nah,
secret's
what?
It's on the other side.
That's what I'm saying. What do you mean? Which anatomical is most relevant to avoid pancreatic injury?
It's the tail of the pancreas.
Isn't it A?
Most relevant to avoid pancreatic injury.
Which anatomy of the spleen is most relevant to avoid pancreatic injury? So if it's close relationship to the tail, wouldn't that mean it's more likely to get injured?
Yeah, which is the most relevant to avoid pancreatic injury. It's
Oh,
close.
okay. See what you're saying.
I still think it could be in C though. A neonate of group O rhesus positive mother develops jaundice on day 1 from hemolytic disease due to ABO incompatibility. This occurs because the mother has anti-D IgG.
Yeah, I agree. I think it's A.
That's it. That's it. Yeah. The mother has, yeah, that's it. A 3-year-old girl presents with generalized cervical lymphadenopathy after an oropharyngeal infection. Which group of lymph nodes will most likely be enlarged?
Cervical, deep cervical, no?
Yeah, deep cervical, yeah. It could be the
It has
popliteal.
to- No, I think it's the inguinal.
Oh, yeah, yeah.
Yeah, I think she spent too much time on somebody's island. 29.
A 30-year-old man has marked unconjugated hyperbilirubinemia and anemia after a viral illness. His FBC shows high reticulocyte count and normal MVC. Which type of anemia is this most consistent with? Okay, I know
C.
this. Yeah. Well,
Wait,
the viral
no.
illness is the other way.
Unconjugated hyperbilirubinemia and anemia after viral illness. Anemia of chronic disease. Yeah, okay, I agree. Anemia of chronic disease.
Yeah, it's not aplastic and it's not hemolytic. Yeah. This is macro and this is micro.
Yeah, easy.
And this is both macro and micro.
Easy.
A medical student is asked why fetal hemoglobin is advantageous in utero. The best answer is C.
Peter Isler, yeah, cyroxine. Yeah, agreed. C.
31. Suspected thalassemia has a normal iron study, but microcytosis and target cells on film, which further test best confirms a globin synthesis defect. Electrophoresis. Yeah. A 37-year-old woman has long-standing iron deficiency anemia due to heavy menses. Which serum best indicates it is low ferritin?
Low ferritin, yeah.
A mutation in the 5-UTR, the ferritin gene, causes loss of translational control in low iron states. Which of the Which is the normal effect of low intracellular iron on ferritin?
Ferritin
Low
synthesis
intracellular. It
decreases, no?
increases. Oh, you say decreases.
Loss of transition control in low iron states. What is the normal effect of iron on ferritin synthesis?
If you have low intracellular iron, that means that you want to achieve homeostasis. So you're going to produce more ferritin.
But why would you want to produce more ferritin if you have low iron? Well, doesn't ferritin store iron? So why would you want to?
And a mutation causes loss of translational control. Yeah, I agree with that. No, but it says what is the normal effect? So a loss of the loss of translational control in low iron states. So that's what's happening in this one. In this one, you have low ferritin, so you have low iron, but it's saying what is the normal effect? So I personally think that you have increased absorption that's going to increase ferritin synthesis. But I am a dumbass sometimes, so we'll see.
I think you're right. I think I'm being a retard. Oh, I guess I was right.
You were right. Oh, I'm a moron. I got to figure out a way to get a Neuralink chip.
Hey man, you gotta get that Chinese model because 50-year-old man that's cancer present with the metastasis of Burkitt's node. This node receives lymph ultimately from which conduit? Left supraclavicular thoracic duct, no?
Yes, it is.
For should be the mother receives into what is the purpose of this profile to destroy fetal to prevent maternal sensitivity? Yep. 62-year-old woman presents with anemia, low MCV, low serum iron, and high ferritin. Low MCV, low serum iron, high ferritin, iron deficiency. Yep. Well, please, was it? Is it B? Was it B for 36?
Yeah. Why?
Because I clicked it and then my Notion decided to open up an AI tab. Okay, 37, seminal poison, spondylomegaly, recurrent infections, which components of body system primary responsible for initiating immune system to bloodborne pathogens? Oh, bloodborne antigen, isn't it the spleen?
No, spleen. Yeah, my bad. Sorry. Yeah. That's in the marginal zone.
Yeah. Patient has a mutation that prevents class switching from IgM to IgG. B-cell maturation and lymphotissues most likely impaired germinal center reaction with T-cell help, no?
Yeah.
"39. 14-year-old girl presents with easy fatigability. FPC shows low hemoglobin, low MCV, but normal serum ferritin. HB electrophoresis normal. What next step best is cytoplastic anemia from other markocytic anemia? Yeah, I think B, no? Prussian
Yeah.
blue staining?
Yeah. I don't know what serocytosis is. I assume it's just the shape of the RBCs.
Prove his hemolysis.
Why does
C. B.
improve?
A splenectomy. Oh,
How does a
yeah, I think B.
splenectomy improve his hemolysis? No. What?
I think it's B. It removes the main state of red cell destruction.
Yeah, B's the only one that makes sense, but I don't like it.
Check on Gemini.
Oh, and okay, I understand what the question's saying, right? How does it like improve his hemolysis? Like, how is it like preventing the hemolysis?
Yeah.
I interpret it as like, how does it improve it? Like, how does it make it better?
Oh, fair.
Anyway,
56-year-old man receives a large unmanaged transfusion overseas and 24 hours later develops fever, hypotension, hemoglobin. What is the most likely? Yeah, recipient C. Partner is also heterozygous. What is the chance she will be clinically affected? 25%.
yeah, there will be one question like this in the exam.
Guaranteed.
Oh, wait, hang on. Beta thalassemia major.
Yeah, that's both of it. So that's still 25, no? Because it has to be the homozygous recessive one.
Yes. Yeah, it's 25 either way. But a question like this will be asked.
Guaranteed. 27-year-old man has lymphadenopathy in the right groin foot infection. Which lymph nodes, the right groin, superficial inguinal, no?
Yeah.
Let's see. Umair's para-aortic lymph nodes are always swollen. 44-year-old woman has normocytic anemia.
No
Blood
clue.
film shows spherocytes and polychromasia. Direct comb. What? Which mechanism? What is Coombs?
I wanna see-
Goon's test?
I want to see what Coombs test is. Antibodies that may stick to your RBCs and cause them to be destroyed. So B.
Autoimmune destruction of red cells? Oh, yeah, okay. Bro, what? How? I've never seen Goon's test in my life, bro.
That's high yield. What do you mean? Preeti spoke about that for 3 lectures.
Oh, sorry, I forgot. You're right. My bad, bro. Preeti did speak about that in 4 lectures. You're right.
Oh, I must have been sick for one.
Damn. But she also said that wing scapula would be on the midterm or the final, and that question never came up.
Could be an MCQ.
True. 44, 40.
45.
Which
yeah.
one did we put? What did we put for 44? Iron deficiency? Or sorry, hemolytic. A B.
Yeah.
44, 45.
Yeah.
12-year-old boy suspected X-linked recessive immunodeficiency has only males affected in multiple maternal generations. What's his pedigree and try? Female carriers can transmit to 50% of sons. See?
Yeah.
46. 6-year-old woman has hepatomegaly and high serum ferritin due to hereditary hemochromatosis. Which additional clinical feature is typical of iron overload states? Skin hyperpigmentation. Yeah. Skin gets bronze. 35-year-old man has anemia with low serum iron, normal transferrin saturation, raised ferritin. Marrow shows abundant iron, but recycled erythroid iron use. This is what the
Oh. B.
it's better be anemia of chronic disease.
Yeah.
I would have said that because I didn't know what the other ones were. I've heard of pernicious, but
Pernicious can result in a B12 deficiency.
oh, easy. Yeah, I got that last one. B12 deficiency. 25-year-old woman with systemic lupus
I don't know what
erythematosus develops cancer. Oh, it's all the cells are affected.
All of them lose numbers. Okay.
Because I remember this is you and what's his name, Liam were talking about, and Liam was like pancytopenia for leukemia or lymphoma.
Okay.
Yeah, C, bone marrow
Yeah.
hematopoiesis. 49 neonate of an RH negative mother, the mother did not receive any NAD. What is the most immediate treatment to prevent connector? I've heard of that. Bro, I'm gonna YOLO it and say it's intravenous.
This is high yield. What do you mean?
High levels of bilirubin in an infant's blood.
That can result
Oh,
in
you're right. Damn, bro. I religiously watched Suarez's lectures, and I remember her bringing it up. Exchange transfusion. Bro, that's why you need to come to Suarez's lectures, bro.
A 32-year-old man has a deletion in the beta globin gene and continues to produce enough HbF to remain only mildly anemic. This is because
Which composition magnet explains this? Beta globin continues to produce enough hemoglobin F to remain only mildly. C, yeah. C, I agree.
Yeah.
C.
Bro, you remember when the clinical significance of the myohyaloid line was spoken about for 3 lectures?
Oh, bro, obviously, I remember that. I remember Dr. Juan, he walked up to me after and he said, this is super high yield. This is going to be the first 5 questions on the MCQ.
Yep, and then that didn't happen. All right, you want to read it out?
Yeah, one sec. Bro, can you send the Coombs test question into the Discord and go like this? This is super high yield.
I'll do it now. Which fuck? I hit this one. Yeah, bingo. That.
Oh no, my boy disconnected. What happened to Alessandro? Discord trolling. Bro, what happened to my boy? I think his laptop died. It's okay, I need the break right now anyways. I'll just wait for him to come back. I'm gonna go lie in bed, contemplate life for a little bit. And then we're gonna go until like week what? I'm saying we do half of it today. We do up to week 16, and we call it a day. And we'll do the rest tomorrow on stream. Because I want to go through Nick's questions. But before I start going through Nick's questions, what I'm gonna do is I'm gonna lie down like 5 minutes, put on a 5-minute timer, then be back. Because I have not eaten any food. Like I've just been eating like junk, all probiotics and raspberries, and I had a pretty healthy first meal as well, but yeah, I've been just mucking them carbs in, to be honest. Oh, bro, I was about to take like a 5-minute nap waiting for you, bro.
Nah, my laptop went flat,
Oh, fair.
so it's on back.
Easy. Okay, what are we saying? We go up to week 16? We do half of it?
Yeah. Why'd you call it Goons test?
Bro, it's Coombs test. It sounds like Coombs sounds like goons, bro.
All right, let's see 13.
But, no. 24-year-old woman at 10 weeks gestation requests termination because of severe financial hardship. Her doctor personally opposes abortion but practices in her jurisdiction where termination is lawful. Oh yeah, principalism. Autonomy. Agreed. Yep. Full moral status from conception. Yep. Agreed. Yep. Yep. Mm-hmm. Agreed. Yep. Agreed. Yep. Yep. Oh, maternal consent is sufficient?
Yeah, key legal point.
Oh, I don't know that. No, I think you're right, but I just never knew that.
That's fair. Yeah, because the mother's the patient.
True. Couple seeks pre-implantation genetic testing to avoid transmitting the severe recipient. Aims to prevent a serious well-characterized genetic disease in offspring. See,
Mm-hmm.
doctor refuses to provide termination for non-medical sex selection, arguing it is unethical, although not expressly prohibited in that state. First person made defense on defense. I think B.
Yeah.
Bro, what is this? It's all, it's all bioethics.
Yeah.
Was week 10 all bioethics? I don't think week 13 was all bioethics, bro.
Week 13 was cystic fibrosis.
That's what I'm saying, bro. Why is it? And I don't think they're gonna ask any bioethics questions on the exam.
Give me a second.
Here we go. I'm like,
Yeah, it's really narrowing down refusal of treatment, patient behavior, and physiological aspects of illness. All right, let's just keep going.
Bro, but CFTR is super high yield. Like I think we should definitely go through those.
yeah, we'll skip this because this is all. Yeah, you're right.
That's so weird.
That's
Why
all
would
right.
it just narrow down on bio the refusal of treatment then?
That's all right. We'll keep going. We'll just ignore these questions. Week
Hmm.
14.
You want to skip and do like week 32 down now?
Yeah. I don't know why it's really narrowing down on those types of questions. Like this is not what I'm asking for.
Yeah, I don't know. It's weird.
I'll probably move on to Whaley's questions tomorrow.
Yeah, easy.
Week 20. "20-year-old man presents with primary infertility. Testicular biopsy shows normal Leydig cells, but markedly reduced germ cells within the seminiferous tubules. Which structure forms the blood-testis barrier?" That is
A.
Sertoli cells, yeah. Right testicular
Okay,
pain
week
after
20.
yeah. But this isn't week 20 though.
Yeah, isn't that week 18? Yeah, I'm just saying we call it a day now. Like,
Yeah, I think that's all right as well.
gonna
Yeah,
do
I-
Nick's questions and then.
Well, look, I think we gave it a good crack.
Agreed. We got through what, like 12 times 50? That's like
Yeah, 600 questions.
yeah, 600 questions.
Tomorrow, I'm happy to continue through these, obviously picking and choosing.
Yeah, easy.
And then I'll probably do Whaley's questions as well.
Yeah, I'm gonna do Willie's questions after I finish Nick's questions.
Yeah, like she did 262 pages.
Yeah.
I can probably do that tomorrow at work, actually.
Easy. Yeah, I'm gonna. My aim is finish that, and I'm gonna go through 900 of Nick's problems as well.
Yeah.
And then that should be enough for me. Hopefully. We'll see. All right, boss. I'm gonna end the stream because I'm gonna take like a 10-minute nap.
That's so good. I'll see you later.
Yeah, easy.
When you get a chance, if you go back on your phone, send me all the stuff.
Yeah, easy.
All right, thanks, man.
I'll probably send it to you like tomorrow or when I'm done studying today.
That's right. See you soon.
Yeah, easy. Take care.
Good night.
Oh boy. Alright guys, I'm gonna take like a 10-20 minute nap and I'll be back. So my goal is like it's actually gonna be 10-20 minute nap. My goal is to get back. I'm gonna restart the stream. I'm gonna go until so I might just wash off like 10 to 11. Like nap, eat food, and then come back. And then think 12 to 5 will be the next study session. That's a good 6 hours. I'm not going to the gym today because my arm is still hurting from sparring. Oh. And I really want to spend today and tomorrow just studying for this exam and possibly Sunday as well. Like these next 2-3 days is going to be very heavy exam study. So I'm trying to get through like there's 900 of Nick's problems. I don't know how long that's going to take. That's probably going to take 3-4 hours. And then I want to go through my Anki deck as well, like the MD1 deck, and then we'll see what happens, inshallah. Alright, boss. I'll be back, but it'll be on a new stream. Right, take care. Bro, why did you change the color to green? Bro. Why is the brand color this? Man, my man tainted to Packy Green though. He makes sense.